Kayondo Peter, head teacher Kasambia 2 in Chotera.
Kirigwa John Moses, head teacher St. Augustine Kalungu Mixed, Kalungu District.
Sise Nagawa Buka, Mukubiriza, Mvudde Butende Primary School.
Christine Nabayunga, Ngandi Mukubiriza, Ebutende.
Sechitoleko Alice, head teacher Kakoma SS Rakai.
Okay. I think this table will be introduced later. Okay, yes. Anybody else?
Nalukwata Ruth, head teacher St. Maria Goretti Bale, Chotera District.
Batude Flavia, head teacher Nativity of Our Lady SS.
Thank you very much. Our head teachers, our deputy head teachers, our teachers, our educators, the schools present, we really want to welcome you, our peer parents. The schools are at the heart of the work that we do at iChad, and we want to thank you so much for honoring the invitation to be here with us this morning. The banks that are represented here today, abazadde abakubiriza tubaaniriza mwenna, thank you so much for making time to be with us. We value you, and we value the time that you have taken to come and join us. The young people are hosted mainly at the schools, and the work that iChad does fits directly with the young people in the schools. And you can see by the introductions a wide representation of schools where iChad actually does their work. So thank you for opening up your schools to iChad and allowing the team from iChad to work closely with other institutions, the banks, to come up with evidence and scientific evidence to help us improve on the lives of communities, families, and of children. So we are going to go into a recap of yesterday. Our media team, I hope you're ready. Yeah, let's see what transpired yesterday on the screen. You're welcome.
I want to thank you all, our stakeholders, for coming to join us on this public day where we engage our clinic-based stakeholders, where we are conducting our research. I must say we are conducting research in over 48 health facilities in the Greater Masaka region, and allow me to welcome you all to this day.
iChad, we talk about issues of education and access to quality education. The other thing we think about is, of course, healthcare and access to quality, social and community context, including the lived environment that impacts our health. The reason we focus on children and families is because then at any one time in history, we have the highest number of young people living. And when you look at Sub-Saharan Africa, that number is not going to plateau till 2060, if it does. At iChad, what we have really committed to is to addressing these social determinants of health so that we can contribute to the reduction of poverty, improve public health outcomes for children, adolescents, and families.
One of the challenges that we are facing is increasing number of infections amongst these adolescents, 15 to 19.
Some children drop out of school before at the age of 15. Maybe it is one of the reasons. They end up on sugar daddies, sugar mummies.
Ignorance. We will always teach them the measures how this HIV is transmitted, but some take for granted.
The studies that iChad are doing now are also embracing
HIV prevention in girls and boys as well.
Children are free now, so children are enjoying their education well.
This research which you are doing actually helps government to firmly formulate policy and also be able to defend it. Working together, we can improve outcomes for all of us, including younger people and families across the globe.
Wow, let's give a hand clap to the media team for a job well done. For those of you who were not with us yesterday, you've been able to get an idea of how yesterday went, and it was a wonderful day. I want to give a chance to our study participants and the guardians to also introduce themselves. Please go ahead.
Namindwa Rosemary from Bishop. Namindwa Rosemary, Birizi, St. Joseph Mary's. Right now I'm at Bishop Spencer Vocation Training College.
Nze Special Zakasibante Segirinya, ndi muzadde Matale Primary School.
Namagemba Nta Ngamviridde Matale Primary School, and now I'm at Kaliso Secondary School.
Good morning, ladies and gentlemen. My name is Sekaojwa Dennis. I was a pupil at St. Andrews Matale Hill Primary School, and right now I am an enrolled nurse working at St. Noah's Health Center, Vumba, in Chankwan's district.
Okay, thank you, and you're all most welcome. Because many of us in the room were not here with us yesterday, I want to just ask, we have visitors that, who have come from very far that are here with us. And in Luganda, tubaita bava mitala wa mayanja. I think that's the right word. Bave bulaya. We have guests, and I would like everybody that came in from outside Uganda to please stand up and just wave to the team that was not here yesterday. Please, if you know, I know some people are on this side, some on this side, but please stand up. Yes. Thank you. I think you're most welcome. The majority are from the United States. We also have some people from Kenya, I think, that also joined us. I don't know if I've missed out any country, but the majority of the team are from the United States. And they're here to learn and also to see and contribute to the work that ICHA does. So you are most welcome. Our next item on our program is we're going to get remarks from the head of field operations at iChild, Imelda. Are you? Yes, Imelda Namuyaba. Please give her a hand clap.
Good morning, everyone. All protocol observed. My name is Namuyaba Olive Imelda. and I work as the head of field operations at iChad. I want to welcome you all to this forum where we are engaging school-based stakeholders, and today we gather to celebrate our collaborative efforts and discuss the progress we have made in our research initiatives. We deeply appreciate your continuous support and your dedication. In a special way, I want to extend our gratitude to the Ministry of Education for supporting our work, and I want to recognize the presence of Dr. Jane Egau on behalf of the Minister of Education. We thank you so much for honoring our invitation, Dr. Jane. I want to recognize the presence of our head teachers from both primary and secondary schools, over 106 schools that we work with, and these fall under Bridges to Scale, Subi for Her, and Subi for Stronger Families Studies. I also want to recognize the presence of our peer parents that facilitate the interventions we do. The study participants, you are all welcome. I also want to acknowledge the presence of our banks, Stanbic Bank here and Equity Bank. I also want to acknowledge the presence of our district leaders. I know most of them haven't come in, but I see one is here. We expect DEOs from 5 districts that we work with. We expect the mayor, we expect the LOC5 massacre and the cow massacre. Special recognitions go to Massacre Diocese, which we have partnered with since iChad started its work. I want to welcome Father Alex Chimba, the Vice Chancellor of Massacre Diocese, and is also representing the Bishop of Massacre today. You're welcome, Father Alex. Additionally, I want to acknowledge Father Bakulu Kato and Father Semwanga, who have been with us since iChad started its work. We appreciate your support and collaboration. Our mission at iChad is to contribute to reduction of poverty among children and adolescents, and one of the ways we do that is to achieve or contribute to building capacity for the next generation of researchers. And with that, I would want to recognize the presence of all trainees from the various training programs. And I want to, in a special way, thank the different training program leads. That is the Vice Provost Mary McKay, Dr. Noreen Nakasuja, Dr. Yeshimin, our mentors for the trainees, and our alumni. Finally, I would want to acknowledge the leadership of iChad, and that is Professor Fred Sewamala, Dr. Proskovia Nabunya, Dr. Nihal, our training coordinators, and also our center managers. Thank you so much for your leadership. I would want to thank you all for your dedication and commitment to our shared mission. Let us continue to work together to make a meaningful impact in the lives of children and adolescents. Our partnership is key. Your partnership is key to our success, and we look forward to many years of your continuous support and collaboration. At this moment, I would want to invite Dr. Proskovia Nabunya, the co-director of iChad, to give us opening remarks and provide an overview about iChad. Dr. Proskovia is an MPI and PI of many studies at iChad, and she truly believes that if you give people an opportunity, they will surprise you. You're welcome, Dr. Prosi.
Thank you so much, Ms. Imelda. Good morning, everyone. We welcome you on behalf of ICHAD. Thank you so much for joining us for our forum. For those who were here yesterday, thank you for coming back. For those who are coming today, we are very, very privileged to have you today. All protocol observed? That's what I said. I agree you all. So my role today is very short, so I am going to give a brief background of ICHAD and why we do the work that we do. For those who are attending the forum for the first time, you're going to hear new information, but for those who were here yesterday and for those who have been coming to our other forums, we are going to build on what we have learned or what we have heard from other speakers. And this forum is also very special to me because I've been part of ICHAD before it became ICHAD since the beginning. So I would say that I'm celebrating my 20th year. And I'm so happy because I see, faces we began with 20 years ago. So the Reverend Fathers, Father Kato, Father Samomboy, when we were still at Kalisizo in Rakai, I see the head teachers. By then, Chotera, head teacher Julius. So these are individuals who have worked with us since the beginning. And we are so thankful that you believed in us, you believed in our vision and mission, and until now you're still here. So thank you so much. But I also like to acknowledge the new collaborators, the new schools, the new head teachers and contact teachers who are also joining us for the first time. They believe in the work we do, and they've managed to support our studies and our collaboration with schools, and also the communities and parents where we work. So thank you so much. So I'm going to begin with the bigger picture of why we do the work and why we focus on adolescents, right? Because as we know, ICHAD focus very much on children, adolescents, and their families. So why is it that? So there are several issues, there are several global health issues that are impacting, that have implications for adolescent health. So one of those, I'm not going to go through each and every one, but one of those are issues around health equity and social determinants of health. So I teach a course in international child welfare, and there are issues that are really impacting children. Each issue, whether it's poverty, issues of gun violence, issues of education access and equity. So all those issues impact children in one way or the other. And also, because we need to educate the next generation of young people, we need productive adults in the future. We need to tackle those issues today. So if we neglect their health, access to health care, if we neglect their access to education or their ability to access that quality education, we will not have productive members of society tomorrow. So those issues, we have to tackle them. We have to find solutions that will improve those outcomes for our future generation. The other thing is that there are old, new, and emerging infectious diseases. In this area, we are focused on issues around HIV, but we also have other pandemics, which have also brought up some gaps. They how do you call it? They have highlighted the gaps that we have. So in the recent outbreak of the coronavirus, we saw how it impacted children, and some of those impacts are going to continue. So kids were pulled out of school in Uganda for 2 years. It was one of the longest lockdown in the region. And there are so many issues that came around with that, including the impact of the mental health outcomes of children. So what does that mean? We have to be prepared in the future to be able to address some of those issues. What did we learn from this lockdown to be able to address things that come about in the future? Also, there are issues around conflict. over 50 countries have some form of conflict, whether it's internal or between nations. And when that happens, there's a lot of destruction that comes with it. So displacement, access to healthcare, access to education, and children end up suffering the most. So when when you look at young people living in camps or refugee camps, so the opportunities they have, they're not the same as those children who are living in a free world. So we have to think about those subpopulations or groups of children who are impacted by displacement. Other issues including gun violence, so that may not be an issue in some of our regions, but we know that in some developing nations is a huge challenge, and programs and policies around gun violence is a major challenge. So how do we say that, oh, you're free to carry your rifle, you're free to defend yourself, but what about the other people who do not have that opportunity or who do not qualify? But we also see that children are being, are victims of these violences. People shoot up churches and schools and in public places. So that is unacceptable. And finally, issues around climate change. So before, when people talked about climate change, I couldn't even think about how that would impact me. If I'm not in a place where there are, volcanoes or how do they call it, the hurricanes or floods, you may think that it doesn't impact you, but actually it does. Because when you think about what comes after the impact of global warming, the high temperatures or the colder temperatures, how that impacts displacements. So take an example in Uganda. I think we have, they're called mudslides in the eastern region. So when that happens, it displaces people. Those people are going to move from, from the eastern region to come to the city. They are going to be homeless. You are going to find children on streets, right? So it is going to impact you in some way. Okay, those pickpocketers or high crime rates, crime rate is going to increase, but it's caused by issues around climate change. So these are issues that we cannot neglect. And of course, maternal and child health is rampant. It's an issue that is impacting both populations in the developed world, but also in developing countries, including in Uganda. And we know that all mothers and children, they shouldn't die because of lack of access to healthcare needs. So these are some of the things that are impacting adolescent health research. We as ICHAD, we cannot focus on all of them, okay? So that's why we bring collaborators such as yourselves, but also engage in capacity building and training of other individuals who are interested in some of these issues and can lead in those components. So I won't do anything around climate change, but I know there's someone at another university or my career university who may be able to lead those efforts. So at iChad, again, we focus on children. And why is it? Sub-Saharan Africa has the highest growing rate of adolescents, young people, ages anywhere between 5 to age 24, who are young adults. And we know that these numbers are increasing. So the population is not going down, especially in Sub-Saharan Africa, it's going up, which means we have to meet the needs of these young people at the specific ages. So different ages, let's say 5 to 9, have different needs, and as opposed to 15 and 19 years old, right? So we have to be able to better care for their needs at the different developmental stages. So also the other issue is Sub-Saharan Africa share the biggest global population living in poverty. This is very sad because every time we talk about these issues, Sub-Saharan Africa is is impacted the most, negatively impacted the most. So the biggest share of people living with poverty are in sub-Saharan Africa, and including, in our own region and in Eastern Africa. And also, the big percentage of children living in extreme poverty, meaning they cannot afford the basic needs, right? Including, 2 meals per day, breakfast, lunch, or dinner, or more. Access to healthcare, access to education. So those are children living in extreme poverty. The biggest share of those is still in sub-Saharan Africa. So what do we do, right? Because this has been happening for many, many years. So, and we know that poverty has its implications for children and families. It impacts the communities where we live, right? If everybody in your community is poor, you're more likely to, you're producing children who are going to end up just like the people in that community. And also, with poverty comes with lack of access to those necessary basic needs and resources to improve families' and children outcomes. There's an increased risk factor for young people's health, including engagement in sexual risk-taking behaviors, because we know, oh, we don't have money, my parents cannot afford to buy me nice shoes, so I'm going to find somebody else to do it, right? I'm going to find a sugar daddy, a sugar mommy. You've heard about intergenerational transmission of HIV, intergenerational where young people go to older men or older women for money and other luxuries, which also increases the risk of HIV transmission. There's also a direct relationship between physical and mental health. So all the stress that comes about because of poverty, you have to think about how to feed your children. The children, think about if they are going to have a meal tomorrow, how to send your children to school, how to afford it, take care of them. So that stress is impacting the mental health of the caregivers. And we know that when the caregiver is stressed, the child is going to feel it, right? It's going to manifest in the way you parent your children. And there's a direct relation for that. And then lastly, child development, there's a link between child development and hinders human and social capital accumulation. So we see this. Most of us do not inherit anything from our families, right? Other rich families, they build wealth for their children and grandchildren. But if you're poor, you cannot do that, right? But also, if you're poor, you cannot afford to send your child to school to get the training and skills needed for them to put themselves out of poverty. So which means the cycle is going to continue and it will impact child development. So that is the background. That's the reason why we focus on children and why we focus on poverty. So Imelda, the previous speaker, talked about our mission. So we are really focused on to contribute to the reduction of poverty and improvement of public health outcomes for children, adolescents, and families in low-resource settings. For those who were here, we continue to do this, but in the beginning, 20 years ago, this is the issue that was at front and center for our work. We want to address issues around poverty because we know that is the root cause of all the challenges we see and among children. So even you think about growth, being able to complete school, being able to access healthcare, even socializing, creating those social networks. If you're poor, you're going to end up with a poor person because those are the people you know. So it doesn't give us the upward mobility to even connect with people who may be, in a higher, on a higher income level than us. So, so we started with this issue because we don't want to hide our faces and say, oh, you know what, we know everybody's poor, so there's nothing we can do about it. We want to tackle the issues around poverty to see whether we can actually address the other things that comes with it, including those that are health related. So we try to meet our mission through 4 core components: innovative applied intervention research, and these are through most of the studies that we do, the studies that are being implemented in your schools, but also in health clinics, and I'm going to talk a little bit about those. We build capacity opportunities for new generation of scholars. So this is the reason we are here today, because we have several trainees who are part of the training programs to be able to advance this work, but also to create those new solutions to the challenges that I mentioned in my first slide, that non-ICHAD alone can address those things. The third is raising public awareness and support for economic empowerment interventions. So again, as I mentioned, addressing poverty is at the core of all the work that we do. And the way we address is through economic empowerment. It was not something known 20 years ago. I mean, we have the poverty alleviation programs that that are publicly funded, but the issue around strengthening the capacity of families, working together, you do this, I'll do this, you do this, I'll match it, like working together with the families and making sure that you help these children stay in school, stay within their homes. It was new, and there were several challenges in the beginning, but we want to bring that to the forefront and not say that, oh, there's nothing we can do about poverty. And finally, want to inform public policy and programming. So our research is we intend to inform policies that guide issues around health, but also in education. And with the evidence we generate, we hope that we'll be able to do that at some point. So these are some of the studies. I'm not going to talk about all of them. Some studies are based in health clinics. We talked about those yesterday. Other studies are based in schools, in school settings. So studies such as Bridges, the Subi for Her, Smart Africa, so those who were part of that study. We have Bridges Round 2 is another one following up on the Bridges Round 1, and the Subi for Stronger Families, which we are going to learn about later on as part of the panel. So the reason why we engage, why we do these school-based interventions, because we want kids to be able to, going back to my first slide, education access, the quality of education. It's not just about children going to school, accessing schools, because I know we have so many schools. So schools is not the problem. Children, going to a school is not the issue. But how do you retain them? How do you make sure they get quality education? And how do you make sure they actually transition from one grade to another? When we first started, a lot of students were dropping out of school from primary school because they had no opportunity for them to go on to secondary school because it's expensive. So primary school is free. By then, it was free. High school was expensive. You had to pay. So which means if a child, even if they excelled in primary school but had no hope or had no financial means of attending secondary school, they will drop out. So that's where we wanted really to focus. And we implemented several interventions around economic strengthening, the matched savings accounts and financial literacy, the peer mentorship, where we match children and peers to talk about things around self-esteem and future planning and setting academic goals. So things that usually, you may not talk about at home. So we match them with people who were there, who were near in age to talk about those things. And now we are implementing other interventions such as Amakama Sanyifu, where we engage the entire family, but also talk about issues of education, access, and the importance of educating girls and for them to continue with their education. So those are some of the studies. But below where you see the red, we also have the training programs, again in line with our capacity building component, where we recruit scholars from Uganda. Other countries in Sub-Saharan Africa including in Kenya, in Ghana, in South Africa, Sierra Leone. Countries within that have been underrepresented in research training and capacity. So for them to engage, to learn about how these things are done. So we learn from each other. The people from the US or the Global North learn from us, but also we also learn from them. And also when we do this work, we engage in the dissemination of the knowledge. So conferences like this, we have another one called the Child Behavior Health and the one on economic strengthening. So with those, we engage our community stakeholders. We engage you, we engage policymakers, and we engage our parents and participants to be able to share our findings, and also let you know to talk together on what this means, what are the implications, and what to do next. We also have some policy briefs where we inform that we have delivered to our government, to our parliament, that this is what we have found, and these are the things we can recommend to mental health or children's education in Uganda, and some of these have been part of the mental health act that was passed. And also for our capacity building, we have reports, but overall we also publish our work extensively in journals, and we have this also in a book that we have done. So, and again, this is the backdrop for capacity building, where we're trying to build a new generation of scholars. We found that Sub-Saharan Africa is underrepresented as a continent for individuals who are able to compete for funding, also to be able to be part of the lead authors of findings, of research findings, which generated within Africa. There are fewer who actually put as first authors or lead authors of those findings. And also interventions, most of the interventions we're doing in Sub-Saharan Africa are still guided by theory models that originate from the Global North, right? If we're doing this work, why can't we have models that are been done in Sub-Saharan Africa? So for that reason, these are the 4 different training programs that we have that target both US and Sub-Saharan Africa individuals to be able to get trained on how to conduct this research. They must be interested in issues around child and also mental health or HIV, but also around implementation science. And also, in addition to these programs, we also look in our own backyard. So we have a lot of staff. We have about 70 employees currently at ICHAD Uganda, because we also have ICHAD WASHU. And these have taken advantage of higher education to go on to the US to get their masters in public health, masters in social work, their PhDs, and have benefited. I know I was the first to do this because I worked in Callisto, and I ended up going to the US to do my masters in social work and PhD, and I'm now a assistant professor. So that was my journey. So that did not stop on me. Several other students have gone on from our offices here to go get their education. Just this year, we have graduated 3 PhDs. So these individuals you see, they coordinated our studies here, and they decided to go back to their education. So this is Dr. Samuel Chizito, this is now Dr. Josephine Nabayinda, and then Dr. Joshua Chiyinji, who were here. And also we have our staff here who graduated with their respective undergraduate degrees from Kampala University. So we are not only doing the US trainees, but also our local research assistants and staff to go do that. So that's what we do. But we know that it takes a village to do this. We should see it because you're all here. You're our village. We are community. So we acknowledge our training programs, partner the different institutions that are part of these training programs and universities. Also the research sites, because our trainees after this conference, they have to go to different countries to engage in research or initiate research projects with mentors within those countries, and those are the different countries. And also acknowledge the funding, people who are actually funding our work and who have sustained us for the last 20 years. So that these are the different institutions. Another list of a long list of people who have supported our research from the beginning. So we are very, very thankful and know that without you we wouldn't be where we are today and we wouldn't be conducting this work. So welcome, we appreciate you, and I hope that you enjoy the next few hours with a few presentations and panels as we go on. So thank you so much.
Another hand clap for Dr. Prosy, please. Thank you very much, Dr. Prosy, for telling us the iChad story. Why iChad exists and what iChad is trying to contribute towards the very critical public health issues that we face globally. Okay, and so we really see there that not one institution, one group of people can address these global challenges that she raised, but that collectively, and many of us in this room are putting our contribution, laying that block. And I really want to applaud the work that iChad has done over the last 20 years, which is remarkable. And as I said yesterday, the issue of capacity building is one of the biggest contributions that iChad is making, not only for us Ugandans, but for the region and globally. And on that note, I'd like to ask our trainees, those that have come, our visitors, to also introduce themselves. I was told I was not being fair because I asked everybody else to introduce themselves. And now I'd like that we hear your voices. So please, where are the microphones? Okay. Where do we start from? Okay. Please introduce yourself, your name, and the program you're under, and anything else you'd like us to know about you.
Sure. Moi, c'est Mutia, Banyabo Basebo. My name is Dr. Andrea Balungu. I am a research assistant professor with Washington University in St. Louis, but I have been based here in Uganda for the past 7 years. I do work in maternal and child nutrition. Thanks so much for everyone for being here. Thank you.
Most welcome.
Morning, everyone. My name is Dr. Andrew Semata. I am a neuropsychologist, and I am based in Entebbe. Thank you.
Good morning, everyone. My name is Dr. Harriet Ajilong. I'm a pediatrician and lecturer at Gulu University. I'm also a child GRF alumni. Thank you very much.
Welcome.
Good morning, everyone. I'm called Yvonne Karamaji. I'm an alumni of the Child GRF training cohort. I work with Mildme Uganda as the executive director. Mildme Uganda is one of the leading implementers of HIV work in Uganda. So I'm happy to be here in a region that we have programmed before. Thank you.
Good morning, everyone. I'm Melody Frempong, and I'm a PhD student at Washington University in St. Louis, and I'm an RRT fellow.
Good morning, everyone. My name is Dr. Beatrice Madegi. I'm a public health researcher. I'm coming from Nairobi, Kenya, and I'm a trainee Achieve program. Thank you.
Good morning, everyone. I'm happy to be back to Uganda because I did my education at Uganda Christian University. So I'm Thierry Claudien Uhawenimana. I'm from Rwanda and I work with the University of Rwanda College of Medicine and Health Sciences. I'm under Achieve program. Thank you.
Good morning, everyone. My name is Dr. Mary Beth Clifton. I'm a pediatric occupational therapist and assistant professor at the University of Nebraska Medical Center. I'm also a graduate of Wash U in St. Louis, and I'm an RRT fellow.
Hello, everyone. Good morning. My name is Demisha Carlton Brown. I am a PhD student at the University of North Carolina in Chapel Hill, and I am also an RRT fellow.
Okay.
Hello, everyone. I'm Dr. Ashley Kierton. I'm an assistant professor in the School of Social Work and the School of Education at the University of Michigan, Go Blue. I'm also a lead fellow, and I'm very excited about today's workshop and workshops on schools, and thanks to everyone. Nice to meet you.
Okay.
Good morning, everyone. I'm Helen Etiale. I'm a PhD student at Washington University, and I'm also an RRT fellow.
Good morning, everyone. My name is Dennis Boyd. I am a PhD student at Washington University at the School of Social Work, and I am an RRT fellow.
Hi, everyone. My name is Gloria Guevara Alvarez, and I'm from New York University, and I work on nutrition and cancer prevention among HIV populations, and I'm with the Achieve program.
Hello, my name is Dr. Natalie Toussaint. I'm from University of Illinois at Chicago, and I'm an Achieve trainee.
Good morning, everyone. I'm Dr. Sewa Omawale. I'm an assistant professor at the University of Texas Health Science Center at Houston in the School of Public Health, and I am a lead fellow. Thank you.
Good morning, everyone. My name is Claire Najuko, and I'm originally from Uganda. I used to work with iChad as the data director, and I am currently pursuing my PhD at Washington University in St. Louis. Nice to meet you. Oh, I forgot to add, I'm an RRT fellow.
Morning, everyone. I am Guma Edgar Innocent. I work for Uganda's Ministry of Defense and Veterans Affairs as the head of the mental health department at Bombo General Military Hospital, and I am an alumni of the Child GRF program.
Good morning, everyone. My name is Dr. Rachel Naitwe. I'm a psychiatrist working with Jinja Regional Referral Hospital, a fellow on the Child GRF Cohort 1, and currently a PhD fellow with Makerere University.
Good morning, everyone. My name is Letitia Chohanjirwe, a psychiatrist working with Utabika Hospital, Child GRF fellow, alumni.
Good morning, everyone. My name is Portia Nate. I'm originally from Ghana. I'm a PhD student with Washington University in St. Louis, and I'm also a staff with iChad on the US team, and I'm RRT fellow. Thank you.
Good morning, everyone. I'm Dr. Anita Kabarambi. I work as the research director here at iChad and an alumni of Achieve program, and I'm also heading out to do my PhD at Washington University.
Good morning, everyone. My name is Molina Isanga. I'm a psychiatrist, a lecturer in Gulu University, and I'm an alumni of Child JRF.
Good morning, everyone. I'm Vincent Sentumbwe, born and raised from Masaka. I'm from Kalisizo. I'm an ICHAD staff and an incoming PhD student at WASHU. I'm an RRT fellow. Thank you.
Hi everyone, my name is Dakota Betts and I am an undergrad student doing research at the University of Michigan with Dr. Masi Matumba.
Good morning everyone, my name is Dr. Sara Matani. I am an assistant professor at the University of Texas Health Science Center in San Antonio. I am affiliated with the School of Nursing and the School of Medicine, and I am a lead fellow.
Njebali. My name is Dr. Chidodziwa Chikwari. I am an assistant professor of epidemiology at the London School of Hygiene and Tropical Medicine. I am Zimbabwean and based at the Biomedical Research and Training Institute in Harare, and I am an incoming ICHAD collaborator.
Good morning, everyone. My name is Moira Chidomajaha. I am a researcher based at the Biomedical Training Research Institute in Harare, and I am also part of the incoming collaboration team with Dr. Chido. Thank you.
Good morning. My name is Teresia Mtavi. I come from Kenya, and I'm a faculty member at the University of Nairobi, and I'm a chief fellow.
Good morning. I'm Dr. Mpamiz Emmanuel from Gulu University. I'm a child GRF fellow. Thank you.
Hello, I am Damali Nalwanga, a pediatrician at Makerere University. I'm a member of the faculty at the Department of Pediatrics, assistant lecturer, and also a PhD student. I'm also a proud Child GRF alumni.
Good morning. My name is Dr. Fathi Andom, and I'm a lead fellow and working as a postdoctoral research associate at Washington University in St. Louis.
Good morning, everyone. My name is Neil Tutlam, originally from South Sudan in the neighborhood. I'm an assistant professor at Washington University in St. Louis and associate director for research with ICHAD and a chief fellow for alumni, lead alumni, all of the training programs.
Good morning, everyone. My name is Masi Mutumba. I'm an assistant professor at the University of Michigan and an alumni of the LEAD program.
Good morning, everyone. My name is Theodros Warku. I'm from Ethiopia originally. I'm a physician by training, currently doing PhD in public health sciences at Washington University in St. Louis. Nice to meet you all.
God, I'm so nervous. I hate this. I'm Dr. Stacy Martin. I'm a faculty member at Portland State University in the United States. I'm sorry. I'm a lead fellow. Thank you.
Yes, thank you. I'm RRT fellow.
Hi, I'm Chelsea Han Sheridan. I'm the training programs manager with iChat, so I get to work with all of these lovely trainees, and we're very happy to be here. Thank you.
Good morning. I'm Bethel Mandafro. I'm originally from Ethiopia, and I'm the center manager for our U.S. office.
I'm going to ask you to bring the microphone this side as well. We have our principal investigators, our co-PIs, our collaborators. I'm seeing many of them on this side. Start with Dr. Ebo.
I'm Ebo Mwebembez. I'm based here in Uganda. I am an implementing partner of the iChat. And many of you parents and teachers and what you know me, I'm one of the facilitators in the field. Thank you, you're welcome.
Good morning, everyone. My name is Dr. Yeshim Tozan. I'm from New York University School of Global Public Health. Over the past 7 years, I'm a collaborator on the Achieve, many of the research projects, and I'm also a partner on the Achieve, iChat projects, and I'm a partner on the Achieve training grant.
My name is Noeli Nakasuja. I'm a psychiatrist, an associate professor at Makerere University. I'm an MPI on a couple of our training programs, as well as a co-investigator on a number of the field researches. Thank you.
Good morning, everyone. I'm Mary McKay. I'm the Vice Provost of Interdisciplinary Initiatives at Washington University in St. Louis. Proscopia, if you have been here 20 years, I think you hosted me at least 18 years ago. And so you have welcomed me to Uganda. So you are all welcome here. Thank you so, so much for all that you do.
Okay. Oh, yes. Let's get the microphone, Prof. Oh, yes.
Good morning, everyone. I think I know most of you. My name is Fred Sewamala, and I'm the founding director of iChat, and I'm a professor at Washington University in St. Louis. And I'm really the common denominator across everyone here. Thank you so much.
Here, we have just this side. In the corner here, there is yes.
I thought I'd hidden myself successfully, but looks like I've been smoked out. My name is Deken Sakena. I'm a psychiatrist and a mentor to a couple of fellows. I come from Makerere University in Uganda.
Good morning, everyone. My name is Stella Ayo Odongo, Technical Advisor, the Global Coalition for Good Schools. I just completed my tour of duty with the UN End Violence. I also sit on the AfriChild board, which is where Timothy works, but I'm also the one in charge of brokering the relationship between the Ministry of Health and the and iChat for the bigger partnership. Thank you.
Thank you very much. I think I want to acknowledge in a very special way, of course, the vision bearer, Professor Fred Sewamala, for really being the common denominator, as he said, that has seen iChat grow over the last 20 years and continuing to grow. And we appreciate you, Professor, and we really thank you for your commitment, your dedication to seeing us here. I also want to acknowledge Vice Provost Mary McKay. She was very modest, but in Uganda we say she's a big person. Muntu mukulu nnyo at Washington University, and we are humbled at how much love you have for Uganda and your continuous availability to us. We have seen you, we have gotten to know you, and we want to thank you very much for your contribution. Thank you very much. And that is not to say that there's no gratitude to all the others, to the co-PIs, Dr. Noali Nakasuja and Dr. Ebo, and many others, Father Kato, all who have been part of the iChat journey. We acknowledge you all and thank you for being here. During the introductions, I was reflecting at how much diversity we have in the room. I don't know if you noticed that we have a number of countries represented directly and indirectly, because some people say formally of, but I noted that we have representatives from Ghana, we have representatives from Kenya, Rwanda, Zimbabwe, Ethiopia, South Sudan. Even from the US, you have folks from Washington University, St. Louis. I think I had Michigan. I had another one that's very, very hard for me to pronounce, but I'll try, Nebraska. And New York as well. So we have quite a lot of diversity, and we also have the UPDF in the house. We have Butavika Hospital represented. We have Maldmay. We have Makerere University. We have former UCU, Uganda Christian University. We have Gulu University. Wow. So we have quite a lot of diversity. Our common denominator, Professor Fred, thank you for bringing us all together. Yes, so I'm also happy to announce that the Vice Chancellor, Makerere University, is also here with us, and he'll be joining us soon. In the meantime, we are going to hear from our representative from the Ministry of Education, the Honorable Minister for Education, Honorable Janet Museveni, requested and sent a representative to speak to us. I must say that the First Lady is very familiar with the work that iChad has been doing, and she actually has come to some of the iChad meetings. She's familiar with Professor Fred and Professor Fred's work, and she has an interest in what we are doing here today. And she has sent a representative who is going to deliver a message to us. But before that, I also wanted to mention that when the teams were introducing themselves, there were a few words that I think may have gotten the audience lost. You were hearing people saying RRT, Child GRF, Achieve, Lead, and I'm sure you were wondering what are those acronyms, or what do they mean? But that speaks to all the capacity building programs. Not all, actually some of the capacity building programs that iChad is undertaking with the intention of really building and strengthening the cadre of researchers and bringing into bear a new generation of researchers. So it's quite impressive, and those RRT, Child GRF, Lead, Achieve, these are training programs that iChad is undertaking. So without any further delay, please allow me welcome Dr. Egao to deliver remarks on behalf of the Minister of Education. You're most welcome. My apologies. Dr. Abel is going to do the honors of introducing Dr. Jane Egao.
Thank you very much. Timothy, his light is too much, but it's okay. You are all welcome. When I look around, I see many teachers I know, I see head teachers, I see guardians. I've been meeting them in schools. So whenever we have a session with schools, I'm very happy because that's where I do my work. Professor Fred, thank you for bringing us together. And Mary McKay, our provost, thank you for coming and always for coming with Professor Fred. By the way, Mary McKay hosted us in her home and gave us a very nice dinner. Thank you. I've never thanked you for that. You all look good and beautiful and smart. Thank God that we are all here. I've been asked to introduce our sister and our guest who represented the First Lady. I want to mention that working with ministries at times is not an easy thing. That's why my sister, she says she's the one who brokers the relationship between ICHAD and Ministry of Health. When I first went to Ministry of Education, I was sent to Dr. Jane Egao, and I found her very, very easy to work with. So I want our guest to clap for you before I even introduce you. She made my life very easy, so that's why I had to mention that. Dr. Jane Egao, she went to Makerere University where she did her first degree and master's. After that, she went to Penn State University in USA where she did her PhD. So she's also a USA lady. When she came back, the first job she did, she was a lecturer at Chamberlain University. You know, when you come from abroad, there are many opportunities. I remember when I came back from UK, after my master's, I got a job to teach at Makerere University. I taught for only 2 weeks. The reason I did that for only 2 weeks is simple. After a week, I was told to give an assignment, which I did. And my students, I was in the School of Population Studies and Statistics. One after that, I had 82 students. When they did their homework and they brought the scripts, they were like this. When I reached home, I said, am I going to be doing this every day, every week? I said, no, I don't think this is what I want. So next week, on Monday, I went to the dean. I told him, you know, sir, I'm very sorry, thank you for giving me a job, but I think I can't manage. He said, why? I was very open. I said, marking is a problem. I ran away. That's how I stopped teaching. But my sister, when she came back, she went to Chambuga and lectured. I think because she was well trained with her PhD and said no, she joined the Ministry of Education as a senior education officer. Because of the good training and working hard, in a very few years she was promoted to a principal education officer in the same ministry of education and sports. Didn't take her long, she was again promoted to be a principal education officer. I think she must be very hardworking. She didn't last in that position. She was promoted to be an assistant commissioner. From there, within the next 6 months, she was made a commissioner. Do you see how she was rising and rising? I've been hearing half clapping. If it is a clap, clap. If you don't want to clap, don't clap at all. You have clapped for being a commissioner, but that's not all. 1 year later, she was promoted to be a director. Good news things were still coming. From there, she was again promoted, and she holds the position of undersecretary. My sister, I think in the next few years, you'll be promoted from an undersecretary to what? Permanent secretary, and we pray you become a permanent secretary. So allow me to invite Dr. Jane Egao, who has represented our First Lady and the Minister of Education and Sports, who was not able to come. But before she comes, maybe she will help me. because Professor Fred has done so much for this country and the world at large, I'm making arrangements for her. Unfortunately, it won't happen this time, but I'm making arrangements for him to meet the President of the Republic of Uganda, and then also share with him the experience and the contribution he's making. You know, meeting a president is not a simple thing. It is very hard. You make a point. My brother from the UPDF, he knows. You make appointments. But life has been made easy for those who visited my home in Chiruhura, or my place in Chiruhura. My neighbor you saw across my hill, the next hill. My neighbor is Jane Boasisi, who is the financial controller, the president's office. So yesterday, when in the afternoon I was in here, I gave her a call. I said, but I want my professor to meet the president. I said, oh. I said, why do you want to meet him? I said, I want to meet him, to have a chat. So he said, when I leave here, I should make a profile of Professor Fred Sewamala, which I already have. I will go and discuss. When maybe you come back next time with your team, we shall have a good lunch or good evening tea with His Excellency, the President of the Republic of Uganda. Allow me to invite our key speaker, Dr. Jane Egau Ekou, the Undersecretary, Ministry of Education and Sports. You're welcome.
Thank you very much for that kind introduction. Ladies and gentlemen, I'm extremely excited to be here, and especially to hear and to learn the profile of people who are seated in this room. I'm very excited. I did not know the extent of Professor Fred's work, but I have seen it today, and I must say, excellent. I am here to represent the First Lady and Minister of Education and Sports, who was supposed to be here, but as has already been explained, she has been caught up in other activities, and she has requested me to come and represent her. But I am very happy that I'm the one who has come to represent her. So I want to recognize everyone in the room. The protocol is long, and I'm really, really impressed. Welcome, Professor Nawange, you new people, and everyone else. I want to recognize the presidents of all the government representatives, if you are here, the research compliance technical team from Uganda National Science and Technology, if you are here. I also want to recognize representatives from Masaka Catholic Diocese. I know you are present here, welcome. Vice Provost of Interdisciplinary Initiatives at Washington University, very welcome, Prof. Ann. ICHAD researchers and collaborators in the room. All our head teachers have seen you here, the Vice Chancellors and representatives of other universities. I have seen the early career global health research trainees and other scholars present. You're all welcome. Ladies and gentlemen, it is a privilege to be standing here on behalf of the Minister of Education and Sports, the First Lady and Minister of Education and Sports of Uganda. Those of you who are familiar with the background of ICHAD and where it has come from, Mama Janet delivered a keynote during the first annual conference on child behavioral health in sub-Saharan Africa that was held by the International Center for Child Health and Development in July 2016. So she was here in person. And so when somebody says she's very familiar with this, she's really familiar. And not only that, it's very, very close to her heart, actually. Since that time, we have had many representatives come and join ICHAD at different fora. From the Education Ministry. At one point, we even had our own State Minister for Higher Education, Honorable Jesse Muingo, and many district education officials have participated in several of these ICHAD's annual conferences in the greater Masaka region. So we are very close to ICHAD, and we appreciate what ICHAD is doing. As we are all aware, children and adolescents in sub-Saharan Africa, and particularly in Uganda, face numerous challenges that often hinder their health development and future opportunities. This is the reality, and for me, I'm happy that this is the reason we are here. With approximately 38% of children in Uganda living in poverty, and the recent COVID-19 pandemic making it worse for existing education and health challenges, the work that organizations like ICHAD do is very much appreciated, and it's even more critical than ever before, and we appreciate what you're doing. Despite these challenges that we have and the circumstances, we know that Uganda is a resilient nation. We've gone through very difficult challenges and circumstances, but we've overcome them. Sub-Saharan Africa, the region where Professor Fred and ICHAD have focused their efforts, has a history of overcoming these challenges. Together, we will continue to address and conquer the challenges that lie ahead of us, ensuring a brighter future for the children of Africa and this nation as well. Ladies and gentlemen, for the past nearly 2 decades, ICHAD has made what would I say, a deep-rooted impact on our education landscape, transforming the lives of children and adolescents across over 20 primary schools, as was mentioned here, and close to 100 secondary schools, and I'm happy to see the teachers and the head teachers here, as well as the higher education institutions, as we also see them here, including universities and vocational institutions. The scope of ICAD's work is both extensive and profound, as I have explained. There are initiatives such as the Bridges to the Future. There is Smart Africa, we saw all of them here on the wall. There is Subi for Her, there is Subi for Stronger Families, and Say No to Stigma. All have implemented crucial interventions designed to enhance financial stability, family functioning, functioning, mental health, and overall health of social incomes. So these efforts have not only improved school attendance and academic performance, but they have also facilitated transition to post-secondary education to many children in primary, and also above that for those post-O level. We know that when they are kept in school, the dropout rate also reduces, and this is exactly what ICHAD is doing through these interventions. Our children face many challenges that are complex and wide, and we must face these challenges head-on with interventions and programs that are equipped to provide the greatest impact for our children of the future. Interventions and programs must address our vulnerabilities by utilizing the existing strength and resilience of our families and our communities. I've already said we are very resilient. I mean, circumstances come, they are difficult, but you find people go through them. At one time, we were locked for some time, for more than a month, and people thought we would die, but very few died, except for those who go home. We survived. So our communities are resilient, and I think we use that opportunity to, to make sure we just support them to make sure we continue to live. We know the power of addressing and investing in material and social support for our children. We also know our government's provision of free primary education has enabled poor families to send their children to school. But the work that ICAD does is in addition to all these, and it really is complementary and supportive, and we need to appreciate this. So I understand that participants in ICAD studies receive invaluable support, and I really want to appreciate this, including school fees payments, school lunches. I understand essential scholastic materials are also given, such as uniforms, textbooks, pens, and exercise books. These are things that sometimes make our children drop out of school. So if they are given through a program like this one, why don't we clap hands? Furthermore, I'm told there is a mentorship program within it, the provision of peer mentorship, and I was very happy to see peer parents. I think this is good. So the peer mentorship program has been instrumental in fostering a supportive environment conducive to learning and personal development. And through these efforts, iChad is not only providing immediate assistance, but also instilling realistic hope and inspirations in our young people. And we congratulate you for that. I also understand that in collaboration with the Masaka Diocese, iChad established a Bishop Kagwa Education Fund in honor of the late Bishop Kagwa. Thank you very much. This fund, we understand, has created as a scholarship initiative, has been a beacon of support for many students in the Diocese of Masaka, particularly those pursuing tertiary education in the agribusiness sector. So we are happy. The ongoing contributions to this fund exemplify the community's commitment to education and the betterment of our youth. And we know through what you are doing, this will continue and continue contributing to the growth and development of this country. There is a need to build research capacity, and I'm happy that is one of the things that iChad is doing, to address health disparities affecting children, adolescents, and their families. I understand this is part of what iChad does through its 4 training programs that have been elaborated here, funded by the National Institutes of Health in the United States. These include Achieve and Child GRF, both funded by the Foger International Center in partnership with the National Institute of Child Health and Development. There's also the Researcher Resilience Training, RRT, which is funded by the National Institute of Mental Health. There's also LEAD Global Program, which is funded by the National Institute of Minority Health and Development, and all these are contributing to what iChad is doing here. So we want to congratulate you for garnering all these partners and really bringing in the support to help our children. Since 2019, these training programs have provided rigorous research training and career development support to more than 120 early career researchers with a focus on child and adolescent behavioral health in low resource settings, including 40 from Uganda and 20 from other sub-Saharan African countries. So this is good. This excludes those who directly apply to Washington University for their master's and PhD programs, which is another respectable number. My understanding is that this year alone, and I have had it here, 4 graduated PhDs with PhDs and 3 masters at Washington University in St. Louis. And 3 of them graduated even from our local universities here. And I think this is really, really good. This is commendable. In fact, during this conference, I understand in the program, we will hear about the progress and accomplishments of several child GRF alumni. The research and clinical work of this training program alumni are already having a real impact on the health and well-being of Ugandan children. And you can hear them proudly talking about themselves. And I was very happy, really, to hear this going on. So the majority of trainees in the iChad training programs hail from or focus their research on sub-Saharan Africa. And that's a good thing, because then it becomes action-oriented and you can apply within our region. This region continues to be disproportionately burdened by numerous pervasive communicable diseases and non-communicable diseases. As a region, we face multiple health challenges affecting our children, adolescents, and their families. And this include the existing endemic communicable diseases such as HIV, TB, we have malaria, and then the emerging and re-emerging infectious diseases like Ebola virus and others. There are increasing incidences of non-communicable diseases such as nutrition deficiencies among our children. There is cancer now on the rise. There is mental health. They are saying everyone is mentally sick except the degree that is what matters, as well as a set of other exacerbating factors such as rapid population growth and poor environmental health, all of which contribute to poor public health and an increased overall disease burden in the region. So in addition, sub-Saharan Africa remains still the world's most affected region by the HIV. At one point we were told it had gone down, but now we hear it is rising again. So, you know, we still have these challenges ongoing, and it's a real problem that we need to handle. In Uganda, while efforts have been made to increase research capacity in the recent years, including a partnership between Makerere University and several universities in the global north, including Washington University in St. Louis. Several of these emerging collaborations are relatively new and could benefit from additional external support. And I think when we meet in a room like this is really a place for networking, and so much can be done in this room as we network over this time of the conference. So while moreover, additional opportunities should be in place to foster South-to-South collaborations. That's what everyone is talking about now. And the exchange of expertise to further enhance capacity building from within the African continent. So while medical, lab, and clinical research is of utmost importance in basic science, it is equally important to study the social dimensions of public health issues. And I was very happy that I heard people talk about, you know, doing a PhD in the social sciences and all that, you know, because all these contribute to the way that we live and our life is affected. When we talk about medicine alone, it won't help us. How do these diseases come in? It's sometimes because of the social work and the social networks that we have and the way in which we live in the communities. So social works is equally important, and I'm happy that the work that Prof. Fred is promoting here includes all that, and we are happy with that. I understand the training programs championed by Washington University's ICHAD and funded by the US government are doing exactly that, and I think we have seen it clearly in this room. So as I don't want to speak so much, and I want to really extend my deepest appreciation to ICHAD and all their collaborators for this wonderful work that you are doing for the community of this country and beyond. Your dedication and hard work are paving the way for a generation of educated, empowered, and hopeful young individuals going forward. Let us continue to support these initiatives and work together to create a better tomorrow for our children. On behalf of the Ministry of Education and Sports, I want to welcome you again. On behalf of Mom, I want to send you her greetings. She was very happy yesterday, actually, as she gave me this assignment. She knows Prof. Fred very well, and she was very happy with the work that ICHAD is doing. So on her behalf, on behalf of the ministry, I want to welcome you all once again, and thank you very much for the work that you are doing in the field that you are concentrating on, supporting especially the young children, the most vulnerable of our population. Let us join hands together to contribute innovative solutions so Africa and the country of Uganda can provide a better future for our children. I say all this for God and my country, and I thank you very much, and God bless you all. That is from the Minister.
Another hand clap for Dr. Jane Egao. Dr. Jane, I want to say that you are the best suited replacement for the First Lady. Thank you for your remarks. I think you have effectively communicated to us. I would like to welcome Professor Nawangwe Barnabas, Vice Chancellor, Makerere University. You're most welcome, sir. So before I invite Dr. Noelin to invite and formally welcome our Vice Chancellor, we have a short video that we are going to show. It's a message, recorded message from Vijay Ramani from the McDonald International Scholars Academy at Washington University. We'll play the video, and then Dr. Noelin will come to welcome the Vice Chancellor to give us remarks. The video, please.
Greetings and a warm welcome to all of you from Washington University in St. Louis. My name is Vijay Ramani, and I'm the Vice Provost for Graduate Education and International Affairs at Washington University. I also serve as the Executive Director of the McDonald International Scholars Academy. And together, I'm delighted to be able to have WashU be a co-sponsor for the 2024 Forum on Child and Adolescent Global Health Research and Capacity Building, which is being held in Uganda between June 17th and 26th, 2024. At the outset, I would like to wish this forum all success. I think there's a tremendous need for capacity building in the domain of global health. And while there's been undoubtedly significant advances in this domain in recent years and decades, it is very evident that there are still significant disparities in health outcomes, sometimes even within a very, very small geographical area. ICHAD, which is a wonderful center hosted at Washington University, has as its mission to contribute to the reduction of poverty and to the improvement of health and overall developmental outcomes for youth and families in low-resource communities, particularly those in sub-Saharan Africa. And this center has been very successful in conducting applied research and on family-level economic strengthening, as well as on empowerment interventions that tackle the effects of poverty, disease, and health-related risk factors for youth. So, ICHAD has been extremely successful. As I said, they have many training programs, and I am particularly glad to see that the trainees from the various training programs are going to be present at the forum. Trainees from each of these 4 NIH-funded training programs are going to be present. They're going to learn together, they're going to work together, and they're going to enhance their skills in global health research. This forum will expose the trainees to effective community-based research collaborations and provide them with an opportunity to participate in and observe the various meetings and interventions that will be held. I understand there's going to be about 200 participants, including the trainees, so this looks like a very vibrant and robust forum. And once again, it is really a pleasure on behalf of Washington University to be able to serve as a co-sponsor for this excellent forum. I would like to convey my deepest thanks and appreciation to all the organizers and to all the participants. Before I close, I would also like to speak very briefly about the McDonald International Scholars Academy at Washington University. This is a unique Scholars Academy. It comprises a network, a global network of partner universities, and we currently have about 90 plus fully funded graduate students funded. They're all called McDonald Scholars, and in addition to being PhD or master's students at the various programs at Washington University, they also undergo training in facets of leadership, community building, and teamwork, and sort of talking across international boundaries and borders. This has been a successful program at Washington University. It's entering its 20th year, and we are always on the lookout for bright and motivated students. And so if any of you are interested further in learning more about the Academy, I'd request you to reach out to any of our ICHAT colleagues who are with you at the forum, and they will be happy to provide additional information to you. So that said, I would like to close by wishing the forum every success. And I look forward to learning more about the outcomes of the forum from Dr. Fred and his wonderful iChat team. Thank you very much, and I wish all of you a very good day and a very good program ahead. Thank you.
Those are remarks from Vijay Ramani from the McDonnell Academy in Washington University. Our Vice Chancellor, you'll recall that in 2022, you signed a memorandum of understanding with the Academy. And as we continue to grow and build, we are building on that foundation. For the purposes of particularly our Vice Chancellor who just came in, I would like you to know that in the room we have a number of schools represented here. iChad works with 106 schools within the Greater Masaka region, and in this room we have head teachers, we have deputy head teachers, we also have representatives from the banks, because iChad works with the banks as well. But in a very special way, we also have representatives from local universities here in Uganda. We also have visitors and trainees from the United States of America. I would like them to just once again wave. I've made you wave quite a lot, but please wave so that the Vice Chancellor can see you. They are from Washington University, but also we have representatives from other universities in the United States and different countries represented here: Ghana, Zimbabwe, Kenya, Rwanda, South Sudan, Ethiopia. So it's a diverse group of people. But very importantly, we also have our local universities also here: Gulu University, Chambogo University, Uganda Christian University, and our very own Makerere University. Mr. Vice Chancellor, I would like the team from Makerere University, particularly because these are your own, to stand up for recognition. Please, Makerere University, please stand up. And I know Dr. Noelin will be saying much more about this, and I would like to invite you, Dr. Noelin, to please come and speak more to our relationship with iChad. You're most welcome.
Thank you. Thank you very much, Timothy, for the introduction. It's my utmost pleasure to welcome you, Professor Barnabas Nawangwe, to this gathering. So just a brief as to why we're here. You've met Professor Fred Sewamala, I guess way before I did get to meet you, because it was with that agreement that Timothy was talking about when I was chasing you to get it signed, but also for us to come up with a training program, you know, of the people that you're seeing here today. We have multiple programs. They are all not based at Makerere University, but we have trainees that are at Makerere University from 2 of them. Before I get to introduce you, the people who are from Makerere University stood up for recognition, but I'll just mention their names. Some of them are mentors on the program, others are actually trainees. So we have Dr. Dickens Zakena in the corner over here, who has been a wonderful mentor to a couple of trainees, some of whom have graduated from the program. We have Dr. Janet Nachigude, who worked with Professor Fred long before I got to join the team, and she's a psychologist at the Department of Psychiatry. And then we have Dr. Damali Nalwanga, who is a lecturer and I promoted you, don't worry. In the Department of Pediatrics, you'll soon be there. Yeah. So that's the team that is from Makerere, but we also have many others who are not present in the room that contribute to the support of the students that are enrolled into these programs. So Makerere is part of this, and I was excited when Professor Fred did approach me. He looked for me. He said I was a very hard person to find, I think like a needle in a haystack, but he persisted in trying to seek a relationship with us to try and promote capacity building, not only for Makerere, but generally for Uganda, and now beyond Uganda, because the training programs get students that come and train within Uganda, even though they are not registered at Makerere. I think that's enough brief for you to appreciate. I know you may know some of this, but I thought I should mention it. So now I would like to introduce my Vice Chancellor to the people in the room. Professor Nawangwe has been Vice Chancellor for Makerere University since 2017. He's into his second term. We still have him around for a couple of more years. And he's always been very welcome whenever we approach his office for any kind of support to anything that is to do with research and training. As he will tell you, our agenda as a university is to become a research-led university, and so he's very passionate about promoting anything that is to do with research, inclusive of which may have things like geared towards training. So he trained as an architect. So if you have any questions about architecture, his specialty was in vernacular architecture. You will ask him what that means. But that's where he's specialized and has published over 40 articles and reviewed journals, articles, as well as book chapters. He was previously the Deputy Vice Chancellor, Finance and Administration from 2013 to 2017, and he also was acting principal for the College of Engineering, Design, Art and Technology from 2011 to 2013, and was also the Dean of the Faculty of Technology from 2002 to 2011, and before then he was the head of Department of Architecture from its inception. So he was there from the start of that department in 1989, and he served till 2002. And all these have been stationed at Makerere University. So I think from that introduction, you can see that he's a committed person, and he's someone that ensures that things grow as he grows along with them. So with him partnering with us and being supportive of the work that we do, we believe he will continue walking the journey with us as we continue this capacity building. I just want to mention two last things about Professor Nawangwe, is that he's chaired so many boards, you know, nationally, regionally, and internationally. And right now is the board chair for the tobacco control in Africa and the Resilient Africa Network. So with that, I would like to invite Professor Nawangwe to speak to us this morning. You're very welcome, Professor Nawangwe.
the guest of honor, Dr. Jane Gao, representing the First Lady and the Minister of Education and Sports, the representatives from the Masaka Catholic Diocese, government representatives, my colleagues from the other universities, and my colleagues, of course, from Makerere University, the Vice Provost from St. Louis, Mary McKay, and my good friend, Professor Fred Sewamala, the team that manages ICHAD, and all the students, ladies and gentlemen. First of all, I must say that I am happy that I was invited once again to address this conference. I did this 2 years ago in Kampala. And as Dr. Nakasoja has said, Makerere is very close to ICHAD. Actually, ICHAD was the house at Makerere for quite a long time until I think 2 years ago, when the space where they were had to be redeveloped. So we actually miss ICHAD at Makerere. And Timothy, we miss you there. I was trying to call you this morning, and I realized you blocked my phone. I don't know whether we did not chase you. We just relocated you for some time. We will be inviting you back. I was invited to talk about global health and child health. Of course, this is not my area. As you heard, I'm an architect. Vernacular architecture is about building houses using the materials you have where you are. Okay? And so our ancestors built their houses using vernacular architecture. There were no nails, there were no iron sheets. They just used the materials which were there. That's what we call vernacular architecture. Now, so that's the topic. I looked up this definition of what global health is, and I got several definitions, but I liked this one, which says that global health is an area for study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. So what are the principles? Again, I found these principles: health as a human right, health equity and social justice, solidarity, evidence-based public and global health, governance, which includes partnership, inclusivity, and participation, resilient and responsive health systems. But the world, of course, continues to face challenges, and these challenges include global inequities, armed conflict and violence, and of course we are seeing that every day. And most of the conflicts still are in Africa. Although the conflicts in Africa, people don't seem to be interested in them. I don't know why. Something happens somewhere in the Middle East or in Europe, the whole world is there. But there are so many conflicts in Africa. Some of them have been forgotten. Forced migration is a big problem for us in Africa. And the Ugandans, at least we are always being praised that we are very hospitable people. Because before Ukraine, we were the second largest recipient of refugees in the world. Can you imagine this small country? Okay. Climate change is a big issue. Extreme poverty, I think, is the biggest issue. And lack of access to health services. Those are the issues that face the whole world, but particularly Africa. 2 months ago, Professor Jeffrey Sachs from Columbia University, who is, in my opinion, one of the leading global economists, came to give a lecture at Makerere University. And when I was having a discussion with him, he actually told me two things. He said the world has created enough wealth to enable everyone to live a decent life. The wealth we have created in the world, even it is enough for everybody to have a decent life. However, when you look at the reality, the statistics show that 1% of the world population holds 40% of its wealth. 1%. The other day I was actually checking something to do with Elon Musk, who I think now has become the richest person on earth. And his worth is greater than Uganda's GDP. His worth is $210 billion. Uganda's GDP is 180. So he's $30 billion richer than the 50 million of us. The emerging issues that have been mentioned even by the minister: climate change, food security, emerging diseases. Well, I don't know whether Dr. Noel and these are emerging diseases, or they were there, but we didn't know. Or they are coming out because we are misbehaving, okay? Disturbing the environment. Natural disasters. We never used to hear a lot of natural disasters, but in Uganda now it is, we even now have a ministry for disasters, okay? Energy, the lack of it, of course. But one big thing is the fast population growth and the youth unemployment and conflicts again. I always want to use this map, which shows the growth of the world population from 1800 to what is projected in 2100. Now, as you all know, Africa was greatly depopulated during 400 years of slave trade. I always sit down and wonder, 400 years slave trade was taking place in Africa, and people were being taken away. So Africa's population was practically disseminated. But I don't know whether this is the law of equilibrium or whatever. Africa's population is now growing very fast. And the projections, as you see from the map there, is that by the year 2100, 50% of the population on Earth will be living in Africa. Now, I don't know whether that is something to celebrate about. Many people somehow are celebrating. But we should celebrate if we have put in place the conditions to feed that population, to make sure that that population is healthy and that they are employed. If those conditions are not there, then we must be prepared for a big disaster. That chart shows Uganda's population as it has been going, and I'm sure even last year, at the other year in the Sheraton, I told you how I understand this population growth. And I told you that when I was a small boy in a small village, township called Busia in eastern Uganda, I used to go to school going through a forest, okay? And this was near town. And I used to jump over pythons, and one time a leopard ran away from me. Yes. Because my name is Nawangwe, which means a leopard. So a leopard cannot attack another leopard, okay? Now, if you go to Busia, it is a huge slum. There are no trees, and that is characteristic of most of the country, Uganda. So the reality in Africa is that the majority of the people are still living in the conditions that you see there. So you go to a village, and in a short time, if there's anything, there will be a big crowd of small children, okay? Malnourished and so on, and of course living in very poor conditions. I looked at the number of physicians around the world. If we are going to address the issues of health, do we have the doctors to deal with that? So this chart just shows you the situation in the world. So in Western Europe, for every 1,000 people, you have 4.3 doctors. Okay, Monaco is out of, I think, Monaco and Cuba, they have very high figures. The United States is 3.6 doctors per 1,000. The average for the world is 1.7. The average for Asia is 2.0. The average for Africa is 0.2. So for every 1,000 people, you have a 0.2 of a doctor. But put the other way around. If, let's assume that the whole world caught malaria one day, and that is possible due to climate change, just like a COVID came, let's assume. But let's use malaria. And then the doctors had to deal with those patients. It means that in the United States, one doctor would have to handle 300 patients. And if they are with malaria, especially the one I see these days, that doctor might be able to deal with those 300 in a day and save them. A doctor in Uganda would have 5,000 patients. By the time of the end of the day, in case that doctor works as fast as the American doctor and treats 300, most likely 4,700 might die. Okay? That's the reality. Now, I want to use some slides that have been given to me by my colleagues who are working in this area, the health workers, and these ones I believe are from Professor Waiswa, School of Public Health, who is doing a lot of work in this area of child health and maternal health and so on. And he sort of also agrees that the major challenges facing African countries are poverty, rapid urbanization, I have told you about Busia, climate change, air pollution. We used to think that air pollution was a problem for China and America. But now we know we have researchers at Makerere who are monitoring air pollution in Kampala and other cities. They actually monitor air pollution in most of the major cities in Africa. And it shows that locally, the pollution in Kampala is worse than the pollution in New York. So it is no longer a foreign problem. I already mentioned migration, environmental degradation, which is happening every day, rapid population growth, and disasters. That is from his own research. And he shows this graph, okay, for the health challenges. There are fast-growing non-communicable diseases. Okay. These are the diseases that I was asking where they came from, Dr. Nakasuja. Probably they were there, but not at the level at which we are now seeing. And then, of course, persistent endemic infectious diseases. I always tell people that Uganda is so good a place to live in that all organisms want to be here. Even Ebola wants to be here. According to the minister, maybe the only one which didn't like this place was COVID. And so not so many people died, even if we did not have the facilities to deal with it. But we have all these diseases coming, and yet the population is growing. And by the way, as the population grows, our production of doctors is not matching that population growth. I will, of course, show you that from that table, we are talking of the average. But there is also another harsh reality, that we use our meager resources to train these specialists. But many of them end up leaving. Sometimes because I have been seeing in the papers, you know, doctors, young doctors, demonstrating that they have not been absorbed by government. So they end up going elsewhere. So the ratio might actually be reducing. The other thing that Professor Jeffrey Sachs told me, and he was actually surprised, he said, how can you as a developing country afford to have graduates walking the street? How? And the doctors at that. How can you afford that? So he said, send them to do anything. Let them go and teach, let them go and help the people in the villages to be more innovative. But don't allow graduates to be on the street. I actually pledged to write a paper for government, and I'll be coming to you very soon, Dr. Gao, with that proposal. How do we get our graduates off the streets? So Dr. Weiss, of course, is working with the World Health Organization also. He works with a lot of international organizations, and they came up with this global strategy for women's, children's, and adolescents' health, 2016 to 2013. What this diagram is showing basically is that this can only be achieved if people work in partnership, different organizations, different agencies. The things are too small for you to see. National leadership is important, accountability, okay, health interventions, of course, health systems, and also being sure of the determinants of those health challenges. Now this diagram is talking about the Sustainable Development Goals, which we are all talking about. And he's sort of saying, what have we achieved since we declared these, and are we likely to achieve them in the next, I think we are remaining with 6 years now, or 5 years. So for no woman should die giving life. At the moment we still have 290,000 women die because of that. No baby still born, we still have 1.9 million. I think these are world statistics. No newborn born to die, 2.3 million. Every child surviving and thriving from 1 month to 20 years, 4.4 million don't do that. Okay. Then they have also talked about the Sustainable Preventive Integrated Child Health, which is a program that they came out. And they say child morbidity and mortality. Worldwide, more than 5 million children die every year before their 5th birthday. Okay? Half of them in Africa. And remember, our population for now is just 15%. But 50% of those die in Africa. They also said that this could have been prevented with existing interventions in Uganda. And they estimate that if we did the right thing, we could have prevented 75% of those. The preventive services, of course, have got challenges, the lack of resources. It is often fragmented. So you have so many people. There are so many NGOs in the area of health in Uganda, but everybody is doing their own thing. There's nobody coordinating them. New initiatives, okay, are adding on that fragmentation, and sometimes often lacking aspects outside the health sector. We are doing work with the Karolinska Institute. We have got what we call the Global Health Institute, a joint venture between Makerere University and the Karolinska Institute. And we have realized that the biggest causes of poor health are not health related. There are other things like bad water, okay, lack of education, and so on. So we need to work knowing that we cannot just work within the health sector and forget about causes that are coming from outside. Now this diagram is, it is not displaying quite well, so I will not dwell on it, but it is showing the causes of those premature deaths, and the majority, according to this research, are died even before they are born. Okay? Preterm, I think they call it. And then during birth. That's where the majority, actually. Not the majority, but the largest ratio. Yeah, okay. They have come up with this life cycle of the children up to, say, 14. And basically showing that there must be, at every stage, there must be interventions that should be put in place. Otherwise, if you don't put those interventions in place, then those children are likely not to survive. They have also come up with this ecological family-related approaches for action. And you can see that they are saying that the determinants of health and well-being of children and adolescents are embedded in family, peer, community, and the environment. So all those things count when you are dealing with the child health issues. They are attempting to say we can transform the health system. Now, of course, that is a big task for especially poor countries. Okay. In the developed countries, you have got the health insurance. In Uganda, we have been talking about health insurance for how long now, Dr. Nakasoja? And I think now we have even stopped talking. Huh? Because it is a bit difficult. How do you do health insurance? That is my own opinion. For a peasant deep in the village who sometimes does not even have food for a day or several days. They cannot even afford it. Okay? And then how do you deal with the situation? I was attending the 60th anniversary of the Chinese University in Hong Kong last year. And they invited a venture capitalist, a lady who is a venture capitalist supporting particularly the pharmaceuticals. And she told us, and I will not forget that there is a drug which has been developed in the United States to help some types of cancer patients to survive for at least 3 weeks. And a dose costs $3 million. Yes. Now, if somebody can afford, so I don't know how many doses you need for those 3 weeks. But I guess medicine you take every day. So if you have a drug costing $3 million a dose, which money can build a small hospital in Uganda? How are you going to ensure that you actually get rid of this problem? So there must be innovative ways of dealing with health systems in our poor countries. And they are emphasizing intersectoral collaboration, health, education, child and social protection, among others. There are several others that we must look at. But those three are key. And for me, I think education, not because I work in education, is the most important. Once people are educated, they can look after themselves. Yeah. Now at Makerere, we are trying to, we are not trying, we are actually doing it. We are becoming a research-led university. We are actually doing world-class research, especially in the area of health. When it comes to clinical research, the Times Higher Education ranks our school of medicine among the top 100 schools of medicine when it comes to clinical research. But we are doing a lot of other things, and we are using this research agenda to solve all the issues that I've told you. We believe that as a university, and that must be for all universities, we have got a responsibility to move our people out of poverty through research and through training programs. And so at Makerere, we have that research agenda: health and health systems, agriculture and food security, climate change and environment, natural science and technology, human rights and good governance, conflict and conflict resolution. You can see conflict comes back all the time, because in the circumstances of conflict, as you have seen in Gaza or in Ukraine or in Sudan, you forget about everything else. Okay? We are doing this through some specialized research centers, and here I'm only displaying those that have to do with health. We have our Makerere Institute of Social Research, the Infectious Diseases Institute, which I think is probably the most advanced institute dealing with issues like HIV/AIDS that I have known. We have the Makerere Lang Institute. Energy was an issue. We have a center for energy. We have a Rotary Peace Center. The Makerere Rotary Peace Center is the 7th Rotary Peace Center around the world, and the only one on the African continent. And we are very proud of this. And it came there because we have had a program in peace and peace and conflict resolution for quite a long time. Actually, I was told some of my colleagues were involved in the negotiations with the CON. So they were using their psychological thing to empower those who could talk to CON. The Environment for Development Center and the Makerere Agricultural Research Institute. Many people believe that health begins with what you eat. So if you are hungry, you are not healthy. Okay. We have centers of excellence, the African Regional Center for Crop Improvement. This center is extremely important for us as a country, as a region, because of our region is the worst affected by climate change in the world. And I always wonder why. We have the Great Lakes, we have River Nile, we have the forests, but all researchers say our region is the worst affected by climate change, and the water wars will begin in our region. I hope we don't get there. Okay, the Rotary Peace Center I've already mentioned, the Energy Center. We are beginning a Makerere University Center for neglected tropical diseases. Because as you know, the world research community does research on diseases they know. There are diseases that are not of their concern, or at least they so think for now. Okay? Diseases like sickle cell anemia, nodding disease, malaria. Malaria is still the biggest killer in Africa, and it has continued to do so because it is not in Europe, it is not in America, so the researchers, they are not bothered. But now, we are waking up as Africans and say we must handle these issues. I have mentioned the Infectious Disease Institute and the Water Read project, which also deals with HIV/AIDS issues. So I'll just mention a few snapshots of the innovations that we have come up with Makerere that are helping the rest of the world. Navirapine, I think that one most people now know. That is the therapy to prevent the transmission of HIV from mother to the baby. Tuberculosis rapid testing kit, which was developed also by our colleagues, is being used all over the world. During the COVID, everybody went to their home. So we say, and closed their doors. And in Uganda, we didn't know what to do. Everybody had closed their doors. So people started saying the best thing was to do was to close our doors and hope that the virus doesn't go through the window. Somehow the virus managed to enter through the window. But still we didn't know what to do. because the rest of the world had also closed their doors. But I want to tell you that we did not even have test kits if we suspected somebody has. It took some time before we got our first test. And do you know where they came from? This is the importance of collaboration in higher education. Our first kits which we started using in Uganda came from Case Western Reserve University in the United States. Supposing Makerere had not collaborated with these people, it would take time. Okay. But we started thinking very fast. And so we started inventing, medicines, and ventilators were not in anywhere on the market, so we had to make our own ventilators. But also we have got other innovations like anti-tick vaccine, e-diagnosis of malaria. We can now diagnose malaria without pricking people. People can do it in the village even if there is no doctor. And also still developing the Ebola vaccine with the other people. Now this is the photograph that just shows our minister coming to inaugurate the ventilator that had been developed during the COVID-19 by Makerere researchers. So, with all the wealth we have, I didn't tell you that we celebrated 100 years last year. I'm sure, yeah, you can clap for us. Huh? We are still in a celebratory mood. I am sure that Professor Sewamala, you got our invitation, but you couldn't travel because still of the restrictions. With all the wealth we have gained, what can we do to more effectively contribute to changing the lives of our people? We have one guiding principle, and that is the world is one small village. Look after your neighbor for your own safety. Yeah, because if the neighbor falls sick, you know what happened during the COVID here with our culture? The relatives were fighting to get the bodies of the dead people. And the health workers were struggling with them and saying, you can't do that. Because for them, they felt, this is our own. How can they just be buried without our notice? So in Africa, this is very strong. Look after your neighbor for your own safety. Nowadays, this is Ubuntu philosophy. It is also African philosophy, which says, I am because you are. Sometimes we say, no man is an island. Because you live in a community. We live in a community, and if we talk in global terms, we say the world is a small village. So you cannot afford to neglect what is happening in other parts of the world, especially as far as health is concerned. I was in Washington when there was Ebola in West Africa. And I must commend it is the people from the College of Health Sciences who went to control the Ebola in West Africa. But when Ebola broke up, there was a story that there was a passenger who escaped from, I think, Sierra Leone and landed in Atlanta. And that was all over the television news. It would be like that person has landed in every city. The person was in Atlanta somewhere there. But the whole country was in panic. So the world is a small village. Now, we are doing all this knowing that we must collaborate. Collaborate with everybody who wants to collaborate with us. And I must thank Professor Sewamala for coming back home and seeking us out and saying, can we collaborate? thank you for having that spirit of patriotism, even when you are living in the most advanced country. Makerere is considered the most collaborative university in the world by the World Times Higher Education. Why? Because we have more than 200 agreements with the global universities and institutions. But more importantly, there are more Makerere researchers who publish with the researcher at another university than any other university in the world. And of course, that is very important for ranking these days. And so we say, through collaboration together, we can find solutions to humanity's health challenges. As was mentioned by Dr. Nakasuja, yes, we have a new strategic plan. Our vision is to be the knowledge hub for societal transformation in the heart of Africa, because we are located in the heart of Africa. And we have got a mission and those core values. But more importantly, we want to be a research-led university. We want to modernize our research infrastructure, and the government is helping us to do that. They have established a research and innovation fund, which we are using to modernize our laboratories, establish new research centers. Okay, the only thing that we are struggling with and we are not seeing it coming is a teaching and research hospital, because these colleagues of mine are doing a lot of work, but in very difficult conditions. But if we had our own teaching and research hospital, they would do much, much more. Okay, and of course, partnerships and innovations. So my question to all of you is, will you be Makerere's partner as we build for the future? Thank you very much.
Thank you very much, Professor Nawangwe, for that quite elaborate but very insightful presentation. I think very important is that you have highlighted the openness that Makerere has towards collaboration, and I think you ended it well with the question, will we collaborate with Makerere? And I think the answer is a sounding yes. Thank you very much. I really would like to honor you and thank you for making time to come and join us in Masaka. I know how busy you are, and it's really an honor for us to have you here. I really want to apologize about the phone call you made earlier. I want to really clarify publicly that I think you called my WhatsApp line, which is an AfriCell line, and AfriCell left Uganda. So I've actually sent you my Airtel line so that that does not happen. But we thank you so much on behalf of ICHAD, on behalf of Professor Fred, on behalf of Provost Mary and the entire ICHAD team and everybody in the room. Thank you so much for making time to be with us, for always being open and supportive to the work that we do. We are grateful. Thank you so much. We are going to take a break, and as we did yesterday, we're going to have a tea break. But before we have the tea break, we will have group photos with our guests for today. So I'll request that we lead the high table outside to the front, and then we will take pictures in groups because we are a big group, but we all will converge at the front. I request Rebecca to lead the Vice Chancellor and Dr. Egao and the rest of the high table to the front. So we'll all move. We are going to have tea. We are late. We're going to have tea for only 30 minutes. We'll be back at 12:15 for our next session before lunch. Thank you very much.
to appreciate you so, so much for making time to be with us today. Now, time is not on our side. We're going to have a representative of the bishop, and this is none other than Father Alex. Okay. Okay, he should be here shortly. And then thereafter, we'll have a panel on community engagement, transformation through iChurch interventions. And then I'll give you the names of the people who will be on the panel after Father Alex's speech. Once again, I want to remind all of us who were not here in the beginning, the places of convenience, you get out of the main entrance here, and then you walk straight there on your left. All of us, ladies and gentlemen, we go into one place. But the minute you open that door, then the ladies will be going on the right, and the gentlemen will be going on the left. Again, I want to remind everyone here, because we care and we value your partnership, the collaboration, and everything, and more especially, most importantly, for having accepted to be here with us. We are at your service. So whenever you see somebody in pink shirt or white shirt with iChurch or a t-shirt, feel free to ask them for anything and everything that you would want. You're not bothering us, it's just, it will be a pleasure to be at your service. Thank you so much. This is a powerhouse. We've had a powerhouse today where you have so many big people in varied positions. We are blessed. Isn't that cool? And I also want to remind members that you're seated there with somebody. Make sure that you get out of this room with 3, minimum 2 friends or 2 contacts added onto your list. Okay? Social capital is extremely important. Grab every opportunity to add on your lists, to keep networking. Share experiences. Because we're doing different things, not only in iChurch, but also in our respective places of work. So it's important for us to share. You never know. Possibly you've been looking for something and the guy seated next to you or the lady seated next to you has the answer for you. So make sure that you network. Don't stick to the ones you have known. As it was in the beginning, so is now and ever shall be. It's very well in the Bible, but in social networking, no. There is a change of program. I've been reliably informed. No, it's the younger one. Okay, we in the interest of time, we are going to start with the panel, and then as and when Father comes back, because I understand he's with the representative of the minister and the vice chancellor, they're, at another activity. But right now we're going to have the panel, and one thing I'll promise you, we are not going to spend more than 1 hour. We are not going to spend more than 1 hour. So with that, I want to invite Dr. Ebo Mwebembezi from Reach the Youth Uganda, and one of our, he has so many quotes: collaborator, partner, guardian, mentor, facilitator, all those things. Dr. Ebo Mwebembezi, and then we're also going to have Father Kato Bakulu. I call him Lusokera Wano because he was here right from the beginning, so he knows, he was part of the experience, the genesis of iChurch. So that's why I call him that. And Sarah Kagolo, the head teacher of Chimanya Primary School. Michala Sarah Kagoro, head teacher, Chimanya Primary School, and Muchala Speciosa Kasvante, Subi for Stronger Guardian. Subi for Stronger Families is one of our newest studies at ICHED. Yeah, and this panel is going to be moderated by none other than Dr. Proskovia Nabunya, who is another Lusokera one. Thank you so much.
Thank you so much, Ms. Rebecca, and welcome back from the break. So this panel is about community engagement and transformation through ICHAD, and the study we are going to talk about today, we are going to focus on, is SUBI for Stronger Families. So this is one of the studies that is being implemented in schools. We have other studies, but today we are going to focus on this study. I think we have one slide. So this study is focused on addressing child behavioral health through strengthening financial stability and parenting among families. So previously we've talked about addressing issues of poverty. So one of the interventions we do for this study is actually economic strengthening for families, caring for children. And then we also implement the Amakama Sanyufu program, which is focused on entire family. So here we talk about issues of family support, respectful communication, rules, responsibilities, for us to be able to bring up our children together as a family. So, and what we intend to find is whether if we combine those two components, we are able to address issues of child behavior health. Sometimes, we have children in our families, and if they're not behaving well, we say, omwana oyo mulalo, omwana oyo alina eddala, omwana oyo tawulira. Yet, in actual sense, sometimes it's a reflection of how we are, the family functioning at home. So let's say if the child is not part of the decision making, doesn't know why you tell them to do something, and they refuse to do it. How do they say it in Luganda? Okujema, yes, okujema. They refuse because you did not explain that do this instead of this because of A, B, C, D, right? So these interventions helps us create that family bond, family functioning for us to be able to address issues that may come up. So this study is targeting 900 children and their families between 10 to 14 years, and then we are going to follow these children up for about 4 years after the intervention. So that is the SUBI for Stronger Families. Okay. So now my wonderful panelists here are in different categories. So we have the head teacher, we have a parent, we have a representative from the diocese, and also we have an implementing partner. 3 of these individuals I've known for 20 years, as long as I've been in ICHAD. And so we are just going to talk about your role in implementing these ICHAD interventions, as well as some of the perceived impact that you see among children or the institution that you lead. So my first question, I'll begin with Reverend Father, because you have been there from the beginning. And the question is, what role do you see the church doing? What is the role of the church in implementing this iChad work, but also impacting, and how you see it impacting your community?
Yeah, thank you, Dr. Pros, and thank you for giving me this opportunity to talk before you. I must acknowledge and thank Dr. Fred for having led the way. Each one of us is here because of Dr. Fred. And you have talked, I can give even just a brief background before I answer your question. Now it gets easier for us to relate with Dr. Fred at this moment because already results have shown. But 20 years back, it wasn't easy to associate with him. First of all, he was a young man bringing concepts that were new, and yet during that time we were used to briefcase organization that could come and promise and yet never fulfill. But I think it was a very good risk that we took that is now yielding results. We accorded him a room that we thought was the best in our community, which was the Cardinal's room. But now, after having got exposures, even visiting their country, we saw that it was really, he is just very resilient. They have been talking about Uganda as a resilient country, but before you, I must thank Dr. Fred because he has always been resilient, and it's his resilience with the team he's working with that has brought results. Now, as a church, as a foundation-based organization, we came to interact with Dr. Fred because of the trust he put in us. First of all, he's not a Catholic, but the work he's doing, especially that is helping our children to lead productive lives, brought us together. And all that he had promised over years, he really fulfilled. And then, if I may say, as a diocese, we have built trust among the people we serve. So this also helped even Dr. Fred to get meaningful results because of the trust people had in us. Whenever we could knock at the door at the institutions, we would just be welcome. So he used our trust, and we also benefited from him because of the work he's doing that is in line with our mission. Maybe I can stop here for the time being.
Thank you, Father. But I would like to follow up a little bit because we have several trainees in the room who are really interested in initiating projects. It could be in communities where they're not familiar with. So the question always is, how do I go into the community? How do I initiate these relationships? So can you speak a little bit to them? If they want to initiate those collaborations, what are the 2 to 3 things they need to know or they need to do?
Yeah. Thank you. So one of the key things, you have to associate with a person or with an organization with a good reputation. And another thing is, I had already said about it, hinted about it, you always have to be ethical. In other words, what you promise, you fulfill. And what has helped us with Dr. Fred, I must say, there are research organizations that are only used to extracting data from the community. But with Dr. Fred, it's just different. As he gets data from the community, he even gives support to the community. And that also helps a lot. Have I answered?
Yes. And if they have questions, please ask at the end.
And I wouldn't just imagine 20 years ago, you were at our place and now you are posing questions to me. Seriously.
Things change, but for the better. Thank you, Father. So I am going to move on to our head teacher, Ms. Sarah, because the way I'm looking at this, you know, we have the church, we have the school, we have the parent, and then we have the implementing partner. So, Ms. Sarah, as the head teacher, can you talk about a little bit about your, so when iChad was introduced to your school, what were your initial thoughts and what did you expect and how do you see that relationship going?
Okay. Thank you. Thank you, Dr. Prosi. For sure, iChad, I look at iChad as a blessing in all schools, not only my school. And I pass my sincere thanks to iChad staff. Thank you very much. When I look at iChad, we are 17 years old in iChad, in my institution. 17 years ago, iChad began with SUBI program. SUBI came, and I thank Professor, I beg your pardon, the approaches he used when he came to our institution were more of ethical and the staff. So we expected a lot from him, and we still expect a lot. We think big over him, even up to date. And we have achieved a lot. May I mention a few? Okay, thank you. So, very many changes have occurred, and one of them is performance. The performance of our learners has greatly improved. So, when you look at some of the factors that influence academic performance in schools, one of them based on the background of the homes. So, when these programs came in our schools, the parents were fully involved and are still involved. And yet, some of the parents did not know why they take their children to school. They didn't know even the outcomes of learning. So, that is very wonderful, madam. So, there is again high self-esteem. These are kind of children that couldn't even express in public. But when these programs came in, so parents were brought on board, as well as their children. A child can now understand, I can do this, I can't do this. My ability fits this way. Some of them say, for me, I follow the other side. So they find freedom of defending even themselves by breaking even the silence. Gone are the days when these children were disturbed. Now, for instance, the girls, the men, those huge men, bad-hearted ones, but those things now, at least, to some percentage, it has lowered. Let me talk about even the saving culture of the program for the saving scheme. Both parents and learners have learned to use their money profitably, not in overspending. The saving culture, even getting exposed to banking. Some of them have even never seen the banks. But now they are exposed to the banks, they know how transactions are made, the banking culture, everything. Thank you very much. When we talk about time, I very much thank the iChad staff for being very good time managers. A round of applause, members, to these people. Thank you very much. Our learners have learned to be good time managers because of you. The way you always come to our institutions, we really feel humbled. You come on time, you do everything on time, and you depart on time. That is very good. What about the social skills? Amakama Sanyufu. These children have acquired a lot, together with their parents. And the skills they get from there, from those sessions when they are met at different levels, those skills don't stop there. They are even used during the playtime, during class, even on the way back home. Then there is also the rate at which these children drop from school. What can I say, you people? There is a high motivation. You always give our children the scholastic materials, clothes, because they always get t-shirts from you people. Yearly, they are given gifts, they are given bags. And I love the bags because a child holds the bag, the teacher holds the bag, the head teacher holds the bag. I love that. Eh? No difference. We are the same under one creator. I love that. Thank you, Professor. Learners have learned how to express themselves freely, ask questions in class without fear. Thank you very much. There is much love for the parents. Unlike some years back, some parents used even not to think about their children they take to school. And the children used to hate them completely. But now, there is that gap has been, there has been a springboard. Aisha, you are our springboard. Yes, everything now, parents can express together with their children freely. The fathers who used to beg, no longer beg. The mothers who used to bang, no longer bang. What can't I say? That Aisha is a success of everything. Thank you very much.
Thank you so much. So I'm going to move on to Ms. Kasvante, who is a parent, a guardian of a child in the project. So and please feel free to use any language that you feel comfortable in. So I'm going to pose the same question because when projects like this that promise to give, financial savings accounts, it was a new thing, but you took the leap to say, you know what, I'm going to participate. So tell us a little bit about your initial reactions to that idea and now how you think iChad has impacted your family.
Bwe nawulira nti waliyo okuweerera abaana nasanyuka era ne bazadde baffe ne tujja ne tubeerawo nga tuzze okusanyukirako bannaffe naye tetwamanya ki ekyokukola. Abasinga bannaffe bwe baatuwa omukisa ogwo badduka ne bagenda, abamu bazza wabweru ne bagaa nti naye golaba bino bikola. Ne mbagamba nti ebintu bijja kukola temufaayo, kati batugambye tusasule ssente. Ne mbagamba musooke musome, ebintu byonna byonna bigenda na kusoma mpola mpola n'osooka n'omanya. Abasinga baagenda tebajoyininga eno gurupu. Ne bagamba nze ebirimu ebyokusasula sijja kusasula. Kati bwe baagenda ffe twasigalawo ne tugenda nga tusoma. Twavaawo ne batuleetera emisomo emirungi ennyo. Omwami ono yatusomesa bulungi nnyo, n'omusomesa waffe Plos Bettina naye yaliwo yatusomesa bulungi nnyo, ne Habati waffe yaliwo ne batusomesa bulungi nnyo. Ekikulu baatukwasa omusomesa oba yebbirimu ye Matale yatukwata bulungi nnyo ng'atubuulira abasomesa bajja kutuuka naye nga mutuuke nga mbudde. Ne tujja ne tubeerawo ne tusoma. Kati bwe twasoma ne ndabanga ebintu birungi nnyo. Ababbanka bazze, abaami babbanka baali balungi nnyo. Baatugamba banne muyiga okuseevinga. Nze mperedde abaana bangi naye nze nga sikwatangako ssente ne ziteeka mu bbanka nti zino zakuweerya abaana. Nze mbadde njijayo bujji nga nkola ki? Nga ntwala ku masomero baana. Nzijawo bujja ssente nga ntwala ku masomero. Naye kati wano we batuyigiriza okuseevinga ne tuwaayo ssente zaffe bulungi nnyo ng'ate no tuwa mitwalo 3.5 gyokka. Emitwalo egyo 3.5 gye twawanga mu bbanka baatugulirawo akawunti si ffe twagiggulawo. Twawandiika buwandiisi ne batugulirawo akawunti essente be baazituweerayo. Bwe baamala era ekibiina kya Strong Foundation ekyo ekya families kati bwe baamala okutuweerayo ne batugamba nti buli omu ateekwa okusasula emitwalo 3.5 buli mwezi okumala mwaka mulamba. Twakkiriza, nze nakkiriza ne mpaayo buli mwezi nga mpaayo buli mwezi nga mpaayo paka omwaka ogumu n'ekitundu bwe gwaggwayo. Bwe batuuka okutugamba nti kati wano osobola okutwalayo essente n'ogamba nti osasulirayo omwana nga yali mu P7 tetunaakumalako mwaka. Ne ngamba siniya yesinga okuba obi kanyongere empeeyo sijja kuzijjayo ssente zange kubanga simanyi oba zinaaba zikola zitya. Ne mpaayo essente zange ne zigenda ne batukubisizaamu ate n'olwo nga bw'osasula 3 bakubisizaamu 2 olaba bw'ofuna 7. Nze nagenda okukkakkana nga ndi 7,000 ng'ate sitegedde nakutegeera. Baatugambanga nti kati mugyeeyo essente zammwe woowulirira woozaagalira niwoowulirira oba oyagadde mwana kugamba nti omugulirayo akantu k'okulaba nga omuwaayo ku school fees manya essente wooyagala nti oba kati tukole project. Bwe nagezaako okukola erya project byannema kubanga omwana tabeerawo nze siinagala birya kabizzi. Kaakati nze kye nakola ne ŋŋamba akambireke nja kufuna project ndala. Kati waliwo project gye ŋŋenda okumufunira ya Green World era nja kujja wano mbagambye nti njagalayo 5,100 omwana mmugulirewo manye eyo international wound project ajja kufuna era nja kubanga nfuna ssente ezinaabazongerako ku ki. Kati e project nja kugimuteekamu mbeere nga ntambuza ebintu ebyo. Kati bannaffe abatajja era abaagaana ate abasinga baagaana kubanga abalala baawaayo 3,000 ne bawummula. Bwe baawummulira awo era baabawa emitwalo gyabwe 7 ate oba ofunyeemu. N'ababbanka ate balungi nnyo ababbanka bano buli kaseera batujjukiza teekayo ku kasente teekayo ku kasente. Oluusi ogamba naye siina kandira ndekako naye bo basigala bakola ki bakujjukiza kulaba nga oweerera. Sente zino bwe nzifunye kati omwana wange bwe bajja ku ssomero nabo ne baba balina engeri gye bakwatamu abaana. Omwana bw'aba ajjagala ddaati ng'alinga ekisaanyi amajimbi balina engeri gye bamukwasaamu nadda omwana abeera ng'atandika okuwulira abadde takyakuwulira akuwulira bulungi nnyo. Bwe babaayo eyo obusente akugamba nti bampaddeyo akasente bwe kati jjajja nkole ntya. Kati akasente ako kuomuga nti nedda oyinza okuba nga olina kyoyagala ogula genda okigulemu. Naye n'agenda n'asanyuka n'agulamu ki akantu ke. Ebintu ebyo biyamba nnyo nnyo nnyo. Ebintu bino senga tunaabikola ne tubeera nga tutambula n'ekintu kino nze nsuubira Uganda tujja kuggwamu abantu bano abaana ababi. Eno project nze ngisanyukidde nnyo. Mulaba bwetugasse abasomesa kati nze nanditudde ddi n'omusomesa. Olaba bwetugasse ne ba Professor Nawangu nze nanditudde etya ne Professor Nawangu. Ebyo byonna bw'obiraba nti bitugasse abaana babagasse naffe abasomesa abazadde bannaffe abava e Bulaaya nanditudde ddi n'omukazi asoma mu Amerika nanditudde ddi n'ono. Ekyo kyonna kituyamba okubeera nga tukwatira wamu tulaba nti tujja kufuna abaana ebiseera ebijja nga tulina abaana abaki abalungi abanajja okubeera mu nsi eno. Neyanziza nnyo mukwano.
Thank you so much. Now, I'm going to briefly summarize what she said for our trainees. So, so I asked about her initial thoughts about participating in the intervention, how she has seen that benefiting the family and the community. So she indicated that in the beginning she was very excited about the program, but also there were other caregivers who were hesitant to join because this was promising much savings accounts, financial information. We know how we all feel about finances, right? If somebody is telling you, oh, save this and I'll match you this, you're very hesitant. But she was able to participate, so she insisted in participating in the program. And she found the training or the support from the research staff was very, very helpful because they told them what to expect, what were the benefits and the risks and how everything would go. And also talked about the support from the financial institutions, so the banks, with issues around financial literacy, but also explaining to them how banking works. So that was helpful. She indicated that she had never saved money, put aside money to save in the bank for the children's education, but for the first time she was able to do so. And she's going to be starting a project for the child to continue with income generation. And also appreciated so much that because of iChat and the work we do, we are able to connect people from different backgrounds and to sit in the same room together. Specifically, that she had never, where would she have gotten the opportunity to sit with scholars from the US? So she put you in, but also with the different, with the teachers and the representatives from the ministries. So that has been very beneficial. So thank you so much. Then my next question is to Dr. Ebo, who has been our implementing partner in Uganda for long. You are part of the team that facilitates these interventions. Could you talk a little bit about your first impression of the communities where you have worked, and also share some of those impactful moments that you have seen while implementing these interventions?
Thank you very much. Thank you very much, Dr. Pros. I happen to have had a chance, so one of the few Ugandans who have enjoyed very, very good jobs right from when I finished school. I started my career working with international organizations like the UN in Uganda, UN in South Africa, UN in Sudan, and everywhere. And when I came back home, I also worked with international organizations. So when I was there, Professor Fred called me. I think he was in the US. He said, Ebo, with the program in Nigeria, would you be interested in working with it? I didn't want to give him a no. I just said, okay, I can give it a consideration. But he said I didn't want to go because I just come back from Darfur in Sudan in a peacekeeping mission under war. With all that stress, I wanted to rest home. So good enough, it never worked out. So I was happy. Later on, he came back and said, Ebo, would you work with me in Masaka? I said, what is Masaka? He said, I'm doing research. But I had seen Pros. I knew she was there. So I said, oh, yes, we can do it. So he came, invited me. We came to Masaka. By that time, went to the other side in Sanje. Then there's a school near Chotera where we went and visited. When we reached there, Professor Fred made a presentation. I said, is this true? Because my background training is population research. And when we were being trained, we were never told that you can do research and also do an intervention. So when I went to Professor Fred doing research, and he had interventions, he presented, I sat and watched him. He talked about savings, matching, training people in financial literacy, training participants in IGA. I said, is it possible? Can he match? I kept quiet, I never asked a question. So when we came out, I asked Professor Fred, this is unique. I've seen many researchers, but no one does this. He said, no, it is possible. I got interested. So I started working with him. So my role here, my first impression was that he was liked so much by the community. The school where we went, the kids were very excited. The room was full. The teachers were very excited. He was very highly respected. We were received very warmly. So I was impressed. How is it coming? This guy is so impressive. So that impression was good. What rang in my mind was that people believed in him, and he had presented himself well, and he was objective, and he had a mission to achieve. So people believed in him. That was a very good impression, because first impression is very important. Now, when I got on board, my role was as an implementing partner, because I do community work. He said, I know you have a background in economics, you have a background in veterinary, you have a background in agriculture, you have a background in public health, in research, so do this for me. I said, I will do it. So the first assignment he gave me was to be a facilitator in financial literacy and income generating activities, poverty in short. And I like poverty programs because I come from a humble background. Our parents were not so rich. We had cows, yes, but we didn't have money. And we had cows, but we didn't know it was wealth. We didn't know how to use it. I remember when I was a young boy growing up, we had over 100 cows, but they were there, no selling milk, no nothing. I remember that time you would wake up, our dad would wake us up at 2 a.m. to drink the milk and finish it. Because if you don't finish it, in the morning they milk more milk, they cannot pour it down. Milk is not powered down. In our culture, you don't pour down milk. So you'd wake up at 2 a.m., drink the milk and finish it. In the morning, they milk new milk. No selling milk. So we didn't know money. So eventually, he was able to send us to school, by selling a cow, 2 cows every month, every time, until all the 100 got finished. We even destroyed the crowd. So we went up poor. We were poor. So I knew poverty, what it was. When I was in secondary, I knew what poverty was. So when Professor Fred told me teach about how to make money and how to manage money, I was very happy. That is the job I have been doing with my team here at ICHAD. The impactful lessons I learned from this was that people can change and save. Because when we trained them, including my sister here, when we were training them, we were talking about saving accounts, matching, and what is money? Why do we know? Why do we have to know what money does, and how does it influence our lives? When we did that, what was more impactful, people understood our message. People opened families opened bank accounts, and people started saving. That was very, very, very important. Somebody having a bank account, as she mentioned, seeing bank officials at community level talking to people at the community level and supporting them to open bank accounts, and people start saving, and we marching, and people are getting money from these marches and sending their children to school, starting income-generating projects. It was a wonderful job. So that is something very, very good I saw that was very impactful. Thank you.
Thank you, Dr. Ebos. So I'm going to follow up the same question I asked Father Kato. So you are the implementing partners. I'm sure it's, you work with ICHAD, but also with other individuals or agencies. So for our trainees who are interested in these new collaborations, what are the key things they need to know or they need to have, prior to contacting you to the implementation?
Thank you very much, Dr. Pros. You see, partnerships they are like marriage. When you are going to marry, there's somewhere I read that you should marry a friend, but also making friendship is not easy. So if you are looking for a partner, you must look for a good partner. Somebody who is reliable and trusted, somebody you can depend on. There are not very many people who are trusted and are reliable. So it is very important you do a background check to know that is this the right partner whom I can work with? Do we believe in the same mission? Do we have the same interests? Can I really rely on this person? If you find that this person, he may be very well trained, highly trained, knowledgeable, but he's not a good partner. And you find somebody at a lower level or in the middle level and is a good partner. So in establishing partnership, look for reliability, dependability, and trust. Of course, we all that, and the person has the skills to do what you want him to do. If a person doesn't have that, then you cannot make a good partnership. And even the person coming from out, if a person wants to partner with me, the same thing. This person is asking me to be my partner. Is this person reliable? Does he have a good name? Do a background check. If you find this person is not reliable, people don't trust him, then don't partner with that person. So partner with somebody whom you know can be reliable, can be trusted, can be dependable. If those are not there, and also believe in what you do. If a person doesn't believe in what you do, don't partner with him. As simple as that.
Thank you so much. So before I go to the last, in the interest of time, so I would like to open this up to the audience. So if you have a question, I'll take a few questions. Do we have a mic support? Do we have a question right here? Please introduce yourself before you ask a question.
Oh, sure. Hi, I'm Dr. Ashley Kiriton. I'm a lead fellow. Thank you so much for your insights. I just have a question. You all have spent a lot of time talking about how you can initiate partnerships, and I'm just wondering if you could share how can you sustain them over time. It's quite impressive that you've been able to maintain these partnerships for decades, and so just wondering how you were able to sustain it. Any challenges perhaps you had to overcome, anything just around best practices to maintain those relationships. Thank you so much.
So, Father, do you want to answer? You can. How do you sustain?
Yes. It's okay.
Thank you very much. She's asking about the sustainability of all this what we do. In the very first place, the staff of iChild, they have frequent visits, which visits are prior. They have prior plans. So, before they come to you, they come to your institution knowing that they are on a program, and they always hold more sessions of every study. It is continuous, not until they come in the end with their findings. Yes, it is a continuous process with the support, with the hands-on, research-based. Thank you.
Switch off. So, for me, on my part, I feel that sustaining this partnership, it's because of the work the researchers are doing that impacts even our communities. So they complement what we are doing. Like we did in education, health, already poverty, it has already been mentioned, it's very critical. And this is a research organization that comes to address. And as we, like faith-based organizations, we now talk with evidence-based from the information that is generated by the research. So this keeps us even together to go on, so that the work is not static. Because the more we get information, the more that it will lead to the better our work, better results, meaningful results.
Yes, thank you very much. As I said at the beginning, a partnership is a relationship. It's a marriage. And if you remember the SMART project, we talked about communication. So for me, how I've sustained, is this off? How I have sustained my relationship with iChad and Professor Fred is open communication. You see, if you don't communicate properly and efficiently, it creates problems. There's a lot of work going on in this region here under iChad. Professor Fred communicates with me all the time. When I can't make it to Masaka or anywhere, I say, Professor Fred, I'm sorry, this week I can't make it. It's very disappointing and frustrating if he tells me A, B, C, D, I say yes and I don't appear. You have disorganized everything. You have disorganized the program. So open communication is number one. Then number two is commitment. You need to be committed to somebody if you are in a partnership. If you are not committed, you are going to frustrate your partner. And the moment you frustrate your partner, you can't go far. Here in our culture, we forgive very easily. Somebody annoys you, these things happen. Tomorrow you move on, you invite him again. But some of the people who have gone far and beyond and lived in many countries and cultures, when you disappoint them, it becomes very difficult to forgive you. And if they have gone to forgive, it might come after 10 years when it is too late. So you try as much as possible to avoid disappointing your partner. And the way to do it is be open when you can't make it. When you have something frustrating you inside, be open and tell your partner that, you know, this is not going well. Is there any way who can make it better? So by being open and being committed and knowing the purpose for which this organization exists, the mission, then you will sustain the relationship. Thank you.
Thank you, Dr. Ebel. Do we have any other questions? No?
Good.
Yes, the last in the corner.
Okay, thank you so much for an awesome presentation. So my question is, you've shared all the positives, all the successes. What have been some of your challenges, and then how did you navigate that for our learning? Thank you.
One of the challenges I encountered at the initial stages of the work was to distinguish between a research organization and an NGO. Many people were flocking to us. They thought Dr. Fred's work was like an NGO work. Yet this is the work that had its own research protocol, which was far different. So that was a challenge. But we got over that challenge just by attending the booster sessions. We got even asked to learn more about what research is. So that's what I could say about that.
Okay. One of the biggest challenges in ICHAD here with my partnership, there is too much work in ICHAD. Too much that you may not even have time. Sorry, Reverend Father, you may not have time to say prayers in the morning. Because we wake up at 5, 6, by 7 we are leaving for the field. We are coming back at 5, 6, we have to make reports. And tomorrow we are going back. So if you don't have the energy, you don't have the commitment, you don't have the patience, and you don't have what you do, you cannot manage. So that's challenge number one. Challenge number two is that this is research. Research is different. It's not a usual business. There are certain ethics and conditions you have to follow. There are regulations you have to follow. Everything has to be the way it is supposed to be, which is different from the NGO world. In NGO you can make mistakes, and you go over it, it's no problem. You correct it tomorrow. But here, A is A, it is not A plus B. So that's a challenging thing to many people. But the good thing is that here, most of the staff are young people who can easily fit in and acclimatize and cope and move on. If you come here and you are from, with all due respect to government workers, the government workers have a way they do their things. There's a structure they follow, there's a way they do. If you come here with that background, you may not fit in. Because here it is professional work, and that's it, you have to follow it. If you're not willing to learn and adapt, you cannot manage.
Thank you, Dr. Eba. Do you have any challenges?
Okubanga eno project enoonyereza abantu baffe bazibu nnyo okumatiza era nakyo bakisangayo. Toyinza kumatiza muntu gw'otaategese naye. Bw'omala okumumatiza wano ng'ate waliyo eri amukola ki? Amukyusa. Ne bw'oba omatiza omwana omumatiza bulungi nnyo okugenda okutuukayo ng'ate byakyuse. Olabanga ebintu byonna bibakyukira bukyukiza. Ekyo nakyo nawe kyo weekiri. Sigamba nti ojja kugenda mu straight line, waliwo obuwonvu n'obukono obukola ki? N'ekyo nakyo weekiri.
Maybe what I can say, in some our societies and the community, some of the people, like our parents, thought that maybe this is a business kind of. Bagenda owange omwana tebamulonze. Abalala babaweredde. So there is some kind of a mindset. But these sessions of the staff that are always held have helped us very much, because the more they are sensitized, now they have begun to understand that people are holding some study. It is research, because the society doesn't know some percentage that this is research.
Thank you so much for your contributions. Final question from the audience? If none, I'll ask my final question. Do we have any? How are we doing on time? Okay. Now let me ask the final question from the panel. So we want to look forward in this work. What are some of the recommendations you would give for us as we think about continuing this work? Some of the things maybe you'd like to see, maybe things you'd like for us to improve on. I'll start with Mrs. Seglinia. I'll start with you. And then come here on this side.
Kati nze ngamba nti abantu baffe bano tebandikooye tweyongereyo okusinga wano we tuli. Amasomero batugambye gali 116 twongeremuko mu community endala. Waliwo ebifo ebisinga okuba obubi ennyo eno Masaka tuli kale naye beeyongereko mu disitulikiti endala abantu baffe basobole nabo okubeera obulungi baganyulwemu nga ffe naffe tubeere nga tutambulira wamu ng'eggwanga litambulira wamu.
Thank you. So she recommends extending this work to other schools in other regions so that they can also benefit. Okay, Dr. Ebo.
Thank you very much. One of the best programs ICHAD has is capacity building, training new scholars like we have here. What I would recommend that we also do capacity building for communities, and we create community resource persons to take up some of the work we do, like training in financial literacy. We have teachers, they are well trained. If we orient them into our training manuals and we give them skills and train them as trainers, then we could now ground the work into the community as they take up the work. I don't want this one to look selfish, but I think I'll say it. There are emerging issues, just like presented. But apart from that, we also need now to look at new areas. We have been in Masaka for 20 years. I think time should come when we should expand beyond Masaka and also take up other regions. Take an example, there's somebody who said we have been in their school for 20 years or 14, 15 years. So I think it's good to change, and I would invite you to come to my district for 2 reasons. Yes, I'm going to defend it. And I'll also be talking to Dr. Yvonne Karamaji. So for those of you who read, you have heard that we are in trouble in Mbarara. HIV now, we have the highest 14%. The national prevalence rate is about 5.1, but it's now 14 in Mbarara. In Chiruhura, my district again, it is 9 point something. In Shen, it's about 8. In Sinjiro, they say it is 12 something. So we are in trouble. So I would invite the researchers to come to our rescue, and we see how we can halt or stop or eliminate HIV in Ankole sub-region. Because if it continues at this rate, it's going to spread over other districts as well, because we move. And the reason why it's so terrible in our district, so in our region, it's because it's a hub, a center for Rwanda, for Burundi, for Congo, for Tanzania. Mbara is growing very fast. So it's a challenge. When I look at the statistics and I read, I say, oh my God, are we safe? So soon people will start saying everybody from there is a suspect. And we don't want to reach that level. So ICHAD and all the scholars and researchers, you are invited to Mbarara for research on HIV and AIDS.
For me, I feel that we should continue to strengthen the partnerships. I remember Dr. Fred used to pose a question I couldn't answer. Further, we have been, how can we further this work? But this one, partnering, the Buganda government is on board, the Uganda government is on board, leaders at different levels have come on board, so the information generated can further the work of ICHAD by spreading organically through the different partnerships, so we could strengthen the partnerships.
Thank you, Doctor. Most of which I would have said have been said, maybe a little. ICHAD programs should also be extended to maybe some, what we call hard to reach areas like Kalangala, because when you look at the landing sites areas, when you look at the infection rate, for instance, if we go to the health part of it, the infection rate is higher according to research, and even the form of discipline, I beg, with the time, if it can also be extended to those areas.
Here to represent the Bishop of Masaka Diocese, was involved in another activity with the VC and the PAIs. So right now we are going to have his presentation. But as he's coming, I want to recognize the presence of a representative from the Office of the Mayor of Masaka City. Thank you so much for coming, and I want people to know that we work very well with the local leaders in Masaka, because all our research in the seven districts of the greater Masaka region. But we work, all the district leaders and local leaders, we are in very, very good work relations with them. We want you to extend this to the mayor and tell her that we really appreciate the care and love and the support for ICHED work. Thank you so much. And I also want to let you know that as the father is concluding, we're going to have an evaluation. It's just 5 minutes. We kindly request that you do it for us. Kindly request. I would ask the people who have the forms to take them around after the father has finished, because it's very, very nice to be giving out this when somebody is speaking. We need to pay attention to him. So it takes only 5 minutes. For those who have smartphones, you just have to, we have forms like this, yeah, and that is where the password is. And oh, it's already there. Thank you so much. Thanks to technology, it's already there. And those of you who don't have smartphones, we're going to use hard copies. It's just 5 minutes. And we really appreciate the negative feedback, because for us, we know that negative feedback is what helps us to improve. So just put it there the way you feel about everything. Just be honest with us. It is well. Hello? Hello? Okay.
Good afternoon to you all. I'm Reverend Father Alex Chimba, the private secretary of the Bishop of Masaka Diocese, and I'm also the Vice Chancellor of the same diocese. And I'm here to represent the Right Reverend Severus Jumba, the Bishop of Masaka Diocese, who is outside the country and who would have loved to be here with you. He was with you, some of you, he was with you in Washington in April. He sends you greetings, and he told me to be the bishop within the mores of this conference. And I take the honor to appoint Father Kato the Vicar General. He told me that as the bishop within the mores, the conference mores, you help me welcome the Vice Provost, Mary McKay from Washington in St. Louis, Dr. Fred M. Sewamala, and Dr. Proskovia Nawinya. I also report to him, because he didn't know, that we shall have a delegation from Kenya, a delegation from Ghana, Zimbabwe. I'll inform him when he comes back that we are with you. You are dearly most welcome. the Bishop and the Diocese of Masaka extends its heartfelt gratitude to you, Professor Fred Sewamala, the founder and director of ICHAD at Washington University in St. Louis, United States, and all the persons and institutions you collaborate with, and for choosing to work with Masaka Diocese. We thank you so very much. He said that our collaboration with you is driven by a shared goal. I think, Dr. Abel, you talked about it. We have a shared goal of contributing to the reduction of poverty, and we are united in this mission, and this unity has fueled our partnership with you. The Bishop brought it to my attention that the partnership between Masaka and ICHAD began when I was 11 years old. I'm now 31 years old. And Father Kato brought it to the attention of the Bishop, the late Bishop John Baptist Kagwa, and the diocese bought it. So over the 20 years of collaboration and partnership, I would like to confirm what the chief guest or the keynote speaker said. Dr. Jen was here in the person who represented the First Lady. He said that many schools have benefited from their programs. And I confirm that many of our schools all over the diocese have benefited from your programs. Many have received school fees, lunch at school, and other scholastic materials. We thank you for that, and may God bless you. I would like to report to you all who don't know this, that the center has contributed almost more than 100 million shillings, supporting several students in the diocese to pursue their tertiary education, especially in the agro-business sector. So we thank you so much. I think many of you know Mbuye Farm School, Sanje, and other agricultural colleges. So these people have given us a hand. And on behalf of the Bishop and the diocese, I thank you so much. Yesterday, I came a bit late. I was disturbed by something in the office. But I came here when Dr. Sewamala was saying something. But the last statement of his speech, he said that it takes a village to do this kind of work. Then Dr. Proskovia said, we as ICHAD, we cannot do it. So when somebody talks about a village, maybe you can conceptualize it depending on your own way. But I took the one of Professor Barnabas Nawangwe, the Vice Chancellor of Makerere University. He said, look after your neighbor for your own safety. So the world is a small village. So all these statements are calling us to be action-oriented. What we have experienced here within this room during this conference, if we leave it on paper and leave it here, we shall not yield the fruits. So let us all be good ambassadors of what ICHAD is doing, put it to practice, and we shall impact the world positively. When the missionaries came to Uganda, they came with a strategy. They constructed a church, a school, and a hospital, a clinic. And now in Masaka we have 2 hospitals and 36 health units. But they constructed the schools so that people can be educated, to sharpen their minds, and the hospital so that they can get a scientific explanation of what they are suffering from. We don't want to go to shrines and whatever.
So with education, somebody can know how to feed oneself, can come to know how what we call PHC, primary health care. So if we, the priests, like myself, I have the opportunity to speak to people when they come to church. You, the head teachers, you have many students, pupils. So if you teach them how to care for themselves, primary health care, they won't get diseases. And we shall not need to establish a third hospital. So there is a problem and we are looking for a solution through research. These people, our friends, are an eye-opener to us all that there is a problem and we must work to ensure that we get a solution for it. Our bishop, who is going to celebrate 5 years in episcopacy, in his coat of arms, there are different features, and one of them is coffee. That shows that he's ready to join the fight against poverty. And even other institutions, like the cultural institutions, they are having other programs like Mwanyi Tedimba. So if we go in and we educate our people to be part of that, so that we can be able to eradicate poverty, and the people will be able to educate their children. Because Dr. Sewamala is not going to find money to pay for school fees for 100 years. So we need to be ready to work for ourselves. When the Pope came here, he said, you Africans, be missionaries to yourselves. So we are all being called upon to do something and to educate the masses. When I was still in a parish, I could request the students to come with a hanky because they could come near me, they want to touch me, and I had to accept as a pastor. But the flu was flowing and whatever, so I had to educate them that next term, in all the schools, I'll first ask you to show me your hanky. Because that is PHC, they won't get diseases if they are clean. If they're not clean, they'll get diseases. So we all have the powers to do something. Now, the bishop is thanking all of you for your dedication and commitment to our shared mission, and is calling upon all of you to work together to make a meaningful impact in the lives of children and adolescents. He told me that Professor Sewamala's research is being conducted in Masaka region, and that is the boundary of Masaka diocese. And he sent a plaque in appreciation of the work we were doing. And allow me, or permit me to invite you here so that I hand it over to you. But as you are coming, I would like to bring it to your attention that I myself, as the private secretary and the vice chancellor, I have collaborated well with your team. They are very humble people, and I would want to assure you that I will continue to do so. I don't know who is who, but I received the booklet. I know I can mention 2 of them. Anita Kabarambi, who said that is going away, but we shall continue collaborating with you and pray for you, and also to work with Olivia Imerida Namuyaba. So I promise to work with you, and please, the office is open. We are ready to receive you at any time. Professor, please come forward and receive. Here it reads, Masaka Diocese, Bishop's House, the address is there. This award is presented to Professor Fred Sewamala in appreciation for the excellent and impactful services that you have rendered in Masaka Diocese through research-based innovations. promotion of education, and other community development initiatives. I thank you so very much. May God bless you.
Thank you so much.
Oh, thank you so much, Father Alex Kiimba, for the message and also the gift in recognition of Professor Freddie's work. Thank you so much. And we are also, as iChurch, we are very proud to have the support of the diocese in whatever we do. Thank you. Thank you so much. Right now, we are going to have closing remarks, and this will be done by Dr. Neil Tatram, who is an assistant professor, associate director of research at iChurch Brown School, Washington University in St. Louis, USA.
Good afternoon, everyone. I realize I'm the last person standing between you and lunch, so I'll make this brief. But how can you come after the bishop has talked? But hopefully I'll give you a recap of what we've talked about today, so far from the beginning to the end, so to remind you what we've discussed today. So we started the day off with Ms. Imelda, our field director for Director of Field Operations, who welcomed all the guests here to this meeting. And basically highlighted that the meeting for today focuses on our partners who are education partners, so head teachers from different schools, the Ministry of Education, and she pointed out that yesterday we had the meeting which was focused on our partners from the health sector, so the clinics where we work. She pointed out that we work in over 100 different schools, and I think all of you have seen, and most of you are here representing the schools. And then Dr. Proskovia Nabunya highlighted some of the work that iChurch does and how this work really intersects with the challenges that we face in the global community. So discuss the global health issues with implications for adolescent health, and which is what iChurch focuses on. So she talked about issues around health equity, those are issues that are important that we are trying to address as iChurch. She talked about the old and emerging infections that are a critical issue in global health, and talked about global the issue of gun violence, which may not be a particularly big issue in a country like Uganda or Sub-Saharan Africa, but is a big problem in places like the United States of America, where gun violence now is a big issue that kills more people than accidents in a way. She talked about the idea of global climate change, which is also affecting us. So we have very huge extremes. I think Dr. Fred mentioned this yesterday. It's either too hot or too cold. In my country, in South Sudan, we've had places that have flooded for 4 years in a row. Climate change, for example. So those issues that are impacting global health issues that we try to address. Dr. Proskovia also talked about maternal and child health, which is not only a problem for Sub-Saharan Africa. Yes, it is a bigger problem for us here, but it is a problem in places like the United States, where the health disparities are also very, very significant. And so iChurch is addressing all of these issues, and at the heart of all these issues is really the issue of poverty that is driving all of these health outcomes. And she talked about why we focus on the population that we focus on. So iChurch focuses on adolescents in particular. This is because this is a population that has the highest proportion of the population in Uganda and some of the other countries in Sub-Saharan Africa. So that's a very important problem. And this is also a population that's affected by poverty a lot. And then she went on to talk about the issues, the mission of iChat, basically to reduce poverty in our population and address these health issues as well. We try to do this through four pillars, or so-called 4 core pillars, which is doing innovative and applied intervention research, capacity building, and we see our trainees here. That's part of that work, to train the next cadre of researchers who are going to address some of these complex issues. Also raising public awareness to build support. So this is why we partner with different groups, policy makers. So we are pleased to have the representation from the Ministry of Education. We had the representation from the Ministry of Health yesterday. And then Dr. Proskovia was followed by the representative from the Minister of Health, Dr. Jane, who spoke here on behalf of the Honorable Minister of Education, who also happens to be the First Lady, Mama Janet Museveni. And she highlighted the fact that the Minister of Education actually is very well familiar with the work of Professor Fred and the work that iChat has done. She pointed out that actually Mama Janet in 2016 opened our very first forum here in 2016. And so really highlighting that connection between the Ministry of Education and the work that iChat does going back several years. It really highlighted that Sub-Saharan Africa in particular has experienced a lot of challenges, but we are a very resilient population, pointing out in particular during COVID, we managed to get through some of those challenges as well. And really highlighted the fact that the work that iChat does complements the work that the government of Uganda does in terms of addressing some of these complex issues as well. And then we saw a message from Vijay Ramani, who is one of our vice provosts at Washington University in St. Louis, who welcomed all of us here to participate in this forum and wished all of us here successful meeting. And then talked about basically the McDonald Academy, that partnership with Uganda. And so then one of the things that was pointed out, that McDonald Academy has a partnership with Makerere University, one of the few institutions on the continent here that has partnership with the McDonald Academy, which is really something those of us who are at Washington University, are very proud of. And all of you who have any questions about that can approach any of us here to ask questions. And then we heard from the Vice Chancellor from Makerere University, who talked about, and I think I just want to point out, I don't know if you caught this, so we didn't coordinate the presentation of the Vice Chancellor and the presentation that Dr. Fred and Dr. Proskovia gave yesterday, but if you looked at that presentation, all of the issues that he talked about were very identical, right? So that means that that's an issue. Some of these issues are issues that are of concern not only to us, but to the global community as well. And so I just wanted to point that out. And one of the things that he talked about was basically this idea of poverty driving all of these issues, which is one at the very core of what iChat does. Talked about environmental pollution, highlighting the fact that a city like Kampala, for example, having more pollution than the city of New York, for example, and this is work done by scholars from Makerere University to identify some of these issues as well for us to be able to address. Talked about sustainable development goals, and highlighted that we haven't actually achieved some of these goals as well, and we're only 5 years away from 2030, and so the likelihood of us achieving those goals is really very, very minimal. He also highlighted the many of the causes of these diseases that we have are really not health related, right? So he talked about water, for example, being one of those problems. And this really dovetails with the issue that Dr. Fred talked about earlier on. We call these social determinants of health, right? In other words, social determinants of health contribute to your health outcomes in a very meaningful way, even more than your interaction with the healthcare system itself, which is really important. And then talked about some of the innovations that have come out of, you know, researchers and scholars from Makerere University for the development of nevirapine, for example, of rapid TB testing that have come out of really research that is being done by Makerere University. And then highlighted the fact that Makerere University is one of the most collaborative institutions in the world, and that is true from all of the things that we see from all of the work that is being done here. And then during the panel discussion that was led by Dr. Proskovia, Father Kato gave an overview of iChat's work, going back 20 years, how basically we started collaborating with him and how far we've come, and talked about, you know, what it is that makes this partnership successful, and so and why people would want to work with you, and, you know, advise us, you know, to associate yourself with credible people, which is a good piece of advice. And you also have to do your work in ethical manner in terms of those of us who really want to engage in this work as well. And then the head teacher here who was on the panel talked about the positive impact that the work of iChat has done and has had very tangible results from, you know, whether talking about improvement of performance of the students, students having better self-esteem in essence, and school dropout rates having declined. And these are very critical issues that are going to help in terms of a reduction of poverty and some of the things that we are trying to address. We also, during this panel discussion, we heard about, you know, this improvement of not only the participants or the students, but family functioning has improved as well as a result of some of these the intervention itself. The peer parent talked about how the program improved the life for not only for the students but for the family as well, and the fact that this has actually and really noted how some of the work that iChat does, for example, bringing people together and treating everybody equally, you know, having access to the individuals that you otherwise would not have access to. And Dr. Abel talked about, you know, the importance of partnership and how he has worked with iChat for the last number of years to move this work forward. And then obviously we heard from, lastly, we heard from the representative of the bishop highlighting the work that has been done going back 20 years and basically discuss how iChat has also helped in terms of establishing the scholarship that helps the students with their scholarship, and hopefully have given you a recap of what we've talked about today. And really also want to take this opportunity to thank you all for being with us here for today, and wish you all the best as we conclude our meeting for the day. Thank you very much.
Thank you so much, Dr. Neil. We have come to the end of our program today. Once again, I want to add on to everybody's voice. Thank you so much for making time to be with us from morning up to now. Now, my kind request, can we do the evaluation? Can we do the evaluation? And I also want to find out, tulinayo bannaffe abeetaaga okuyambibwako ku foomu eno nga bo bandyagadde twogere mu Luganda, n'ekyo tukikola. Bannaffe abo njagalako ku mikono egyo oba baliriddawa, so tuyambibweko tusobole okukiggusa. Tubalinamu? Okay. Kale. Nga babagabira forms ezo, ekiddako